afternoon, Excellencies, distinguished participants, ladies and gentlemen. Welcome to the second day of International Conference on COVID-19 pandemic. Yesterday, we were honored with the presence of several VVIPs, including His Excellency President Jokowi of the Republic of Indonesia, Minister Erlangga, and Secretary General of ICCIA, as well as the Deputy Ministry from the Health of the Arab Saudi Kingdom. Today, what we are going to do is we are going to recap of the yesterday's event and the points and the messages that was delivered yesterday. Allow me to start by introducing myself. I'm Shanti Shamdasani. I'm a member of Kadin Indonesia, as well as the president of ASEAN International Advocacy and Consultancy. Yesterday was a long day, but very fruitful day for all of us. The takeaways from President Jokowi's messages are: Indonesians are eligible for the access of vaccine, all of the Indonesian, all of the population. The government budget for vaccine is 181.5 million population. That means 181.5 million of Indonesians will be receiving vaccination. Currently, the government is negotiating processes with various parties to meet the needs of 426 million population of vaccination. This is a tall task for us. The government is enhancing public access through the chain of the government is enhancing public access of vaccine to break the chain of the spread of the virus. The government is also encouraging herd immunity and to foster the economic recovery of Indonesia. I think what we have seen from the President Jokowi's statement yesterday is that the government of Indonesia is working around the clock to ensure that the vaccines are available for all of the population, as well as there is a speedy recovery towards the economic development. From Minister Erlangga, what we have, the messages that he shared with us yesterday is that in year 2021, there was a minus 2.19% of the GDP. In year 2022, so 2021, we see that there will be an increase in the GDP of 4.9%. The government have implemented PPKM to contain the virus spread. The stages of various of the vaccine that will be delivered to the public will be conducted in phases. From January to February, there have been 1 million population that has been vaccinated, and these are mainly medical workers. And from April to December, there will be 77.4 million general public that will receive vaccination. And from Yusuf Imran Kalim, the Secretary General of Islamic Chamber of Commerce, of Industry and Agriculture, the takeaway messages are: the international action is to understanding the human adoption in the new world. There has been limited resources in the least developed countries in managing various crises, and hence this has become an international attention. The ICCIA has joined action and is intending to collaborate not only with Indonesia, but with the rest of the world to make sure that the management of the virus and COVID-19 does not spread further. ICCIA considered affiliations with Indonesia to develop a platform to address the shared vision. From Dr. Hanit Jodair, the Deputy Ministry of Health of the Kingdom of Arab Saudi, he shared with us that he took this opportunity to share the best practices in managing the COVID-19. There has been 10 regulations that has been amended in the the Kingdom of Arab Saudi, and that he is certain that the best practices that has been shared would be able to be disseminated globally. They have formed an organization consisting of 20 sectors to implement the necessary regulations. One of the strategies implemented was to confine and stop the spread of the virus. They conducted PCR tests on 13.6 million population and vaccinated 600,000 people. They have allocated a total of $500 million to manage the COVID-19 pandemic. This certainly is not an easy task for us globally. Yesterday's forum has actually brought to us an insight on how world leaders are joining forces to address the COVID-19 pandemic. Today, we are going to further see how global health and vaccine diplomacy are being conducted all throughout the countries. But before that, I would like to invite Her Excellency Ibu Retno Lestari Priyansari Marsudi, Minister of Foreign Affairs, Republic of Indonesia, to share with us few key statements. Ibu Retno, space and time is yours. While we wait for Ibu Retno,
Rector of Universitas Pajajaran, Professor Rina Indiastuti, Excellencies, ladies and gentlemen. Very pleased to join you today and thank you very much for the kind invitation for this important conference. Ladies and gentlemen, since last year, we have faced complex challenges like no other. What started as a health crisis has spilled over into a multidimensional socio-economic tragedy and affecting all countries. The saying that the pandemic is far from over is not an understatement, as various worrying trends continues to take place around the globe. Worldometer data per 21st February reveals total global cases have exceeded 111 million cases, with more than 2.4 million deaths. While the virus continues to spread, new variants of the virus have emerged in 2021. This means that no one is safe unless everyone is safe. And the slower our joint response is, the bigger the cost and the longer it will take for us to tackle this problem. Economically, the ICC Research Foundation study has found that the global economy will lose around 9.2 trillion US dollars if governments fail to ensure developing economies access to COVID-19 vaccine. Studies reveal that in the absence of multilateral coordination guaranteeing vaccine access and distribution, higher economic costs will be borne by wealthy countries. Meanwhile, increasing geopolitical rivalries, continued politicization of vaccine, and diminishing trust in multilateralism makes it even harder for us to tackle COVID-19. Colleagues, ladies and gentlemen, despite these unfortunate circumstances, we also see positive developments. Per 21st February, total global cases have declined. There are 500,000 less cases compared to last week, or it is a 16% 0.16% drop. And number of weekly reported cases has fallen by almost half in just 5 weeks. Global death rates have also fallen, decreasing as much as 10% compared to last week. 5 out of 6 WHO regions recorded double-digit percentage, including Europe and America. Some countries have increased financial pledges to strengthen vaccine multilateralism to support the much-needed funding of COVAX facility, while other countries have also committed to share vaccine surplus to developing countries. The arrival of vaccine is another encouraging progress. However, my country first mentality or vaccine nationalism to secure vaccine also continues to increase. The UN Secretary General recently highlighted that COVID-19 vaccination is wildly uneven and unfair. Several developed countries have over-ordered vaccine as much as 5 times of its population. So far, only 10 countries have administered 75% of all COVID-19 vaccines. 130 countries have not even started vaccination, and only 6 African countries have started vaccination programs. We also see some regions and countries impose export restriction on vaccine. Furthermore, WHO suggests that stopping COVID-19 will require at least 70% of global population to have immunity. But at the current rate of 2 billion doses per year, it could take years to vaccinate the global population. Ladies and gentlemen, this situation highlights the increased urgency for international cooperation and collaboration to address these challenges. Indonesia has consistently voiced out this call since the very beginning of the pandemic. President Joko Widodo has stressed the importance to advance spirit of cooperation in various international forums, including in the UNGA. In this regard, I'd like to highlight 3 critical aspects of international collaboration and cooperation to fight the pandemic. First, strengthening international cooperation on health issues, both in the short and long run. In the short run, this implies ensuring equal access to vaccine for all countries. Since the beginning of the pandemic, Indonesia has voiced out the importance of vaccine multilateralism. Securing equitable, fair, and timely access to vaccine for all countries is critical, not only for developing and least developed countries, but also important for developed countries. It is the collective responsibility of all countries to promote greater solidarity and political commitment for this cause. And this year, I was recently trusted as co-chair of COVAX AMC Engagement Group, reflecting international trust toward Indonesia to co-lead the global solution to this pandemic. Besides COVAX, Indonesia also supports crucial WHO multilateral platform, such as WHO's Access to COVID-19 Tools Accelerator and WHO COVID-19 Technology Access Pool. Indonesia is also committed to step up vaccine supply through its membership in the JEPI Investors Council and Bio Farma's partnership with JEPI in global vaccine manufacturing. In parallel, Indonesia has promoted this commitment last year during our chairmanship of the Foreign Policy and Global Health Initiative with the theme Affordable Healthcare for All. And going forward, through any platforms and avenues, Indonesia will always fight for equitable access to vaccine for all. In the long run, strengthening regional and global health resilience is key to confront future pandemics. To this end, Indonesia encouraged the establishment of various regional and global resilience and preparedness mechanisms, such as ASEAN Agreement on various regional health resilience mechanisms, including through the COVID-19 ASEAN Response Fund and the Standard Operating Procedure on Public Health Emergency. And then in advancing WHO reform to strengthen global preparedness system, and at the UN, Indonesia initiated on public health and pandemic. Simultaneously, strengthening resilience of individual countries' health system is also crucial, as it is the foundation of a resilient global health system. Second, expediting global economic recovery. Global economic recovery will undeniably be slower if countries don't step up economic collaboration and works toward gradual reactivation of economic activities. To reconnect our economies and businesses, Indonesia diplomacy has worked hard to establish the Travel Corridor Arrangement or TCA with the UAE, Republic of Korea, China, Japan, and in the framework of ASEAN, while also in close coordination to explore TCA arrangement with Japan. The formation of this fast green lane goes beyond just expediting economic recovery, but also it's about sending a strong signal on trust, unity, and solidarity in fighting against the pandemic. Another important economic priority is expanding market access and regional economic integration, including through the signing of RCEP. In this regard, President Joko Widodo stressed that the signing of RCEP is an important symbol of leaders' commitment for win-win cooperation. Indonesia stands ready to strengthen economic collaboration with all countries to fully benefit our people and contribute in expediting global economic recovery. Third is strengthening and reviving the spirit of multilateralism. Only by strengthening multilateralism can we defeat the mighty takes all. In various multilateral forums, including during Indonesia's chairmanship in UN Security Council, Indonesia consistently voiced out the spirit of collaboration and bridge different interests. This is the DNA of Indonesia's foreign policy. And in our region, strengthening ASEAN unity and centrality is vital to achieve a stable, peaceful, and prosperous Indo-Pacific region. These principles underpin the survival of ASEAN in the last 5 decades. The moment these principles perish will be the beginning of the end of ASEAN. In tackling this pandemic, the world needs a spirit of collaboration and strong collective global leadership. Indonesia remains highly committed to stand together with all nations to fight for multilateralism and ensure it delivers during this crisis. Colleagues, ladies and gentlemen, to conclude, health diplomacy will remain be part of Indonesia diplomacy. We will indeed recover stronger if we recover together. And I always say, if you want to walk fast, walk alone. If we want to walk far, we need to walk together. In any circumstances, Indonesia chooses to walk together. Securing national interest is important, but our active contribution to global challenges is equally important too. Indonesia diplomacy stands ready to do both. I thank you and I wish you a productive and fruitful discussion. Once again, thank you very much.
Our distinguished guests, ladies and gentlemen, our excellency, friends, and also I would like to say hello to Kang Windratmo, Kang Andri Hadi, and also all our friends from ICCIA, Mr. Muhammad Idris, Kang Tanon from Setkap RI, Kang Rahman Rustan from Bio Farma. My name is Lia Partakusuma. I'm a chairman of Medical Faculty Alumni Pajajaran University. I'm very proud to be here together with our college in this very important event. So before we move to another topic about global health vaccine diplomacy and also new cultural adaptation to tackle the pandemic, I would like to ask to my colleague here, Ibu Shanti Shamdasani. She is a head of CADIN Indonesia. Ibu Shanti, I would like to ask you, because your experience, about the regulation on vaccine management in Indonesia. Maybe you can explain or maybe you can share with us, please.
Thank you, Ibu Lia. I think when we see the regulations with regards to vaccination or COVID-19, since 2020, not just Indonesia, but almost all countries have either taken out the new regulations or amend the existing regulations in order to manage the spread of COVID-19. In Indonesia itself, when we focus on the country, every month you see there is either a perda or a ministerial decree or a new regulations that have been issued with regards to the lockdown, PSBB, or with regards to the protocols, really regulating public and social behavior has become an important part of our life now. People cannot stand very close to each other. They have to have the protocols and whatnot. But on top of that, what we are also looking, or what we are also seeing, is that there has been a big amount of structural regulations within the Indonesian government and other governments as well, where healthcare approach has been changed or has been modified. And part of this, a good example is the logistics or distribution of vaccines, for example. There has been at least 25 regulations or provincial decree that has been issued with regards to just the distribution part of the COVID-19 vaccine. And I think this is an important mechanism that we need to adopt to ensure that everybody follows the existing protocols and everybody understand the urgency of containing the spread of COVID-19 virus.
Okay, so do you think it's the best policy for our government to choose vaccination for all the population in Indonesia?
Absolutely, because I think Indonesia is 270, 200, between that range, 260 million population. And we may not be able to have everybody covered in a short period of time. It will take time, and as I did mention earlier, and His Excellency President Jokowi did mention yesterday that it will be phased out. But having the whole, as many population covered is one of the key ways in order to ensure that we have a smooth and seamless economic recovery. I think that would be the best approach.
Okay, and what's your opinion about collaboration, especially for several countries like our conference today and yesterday maybe, and also tomorrow? Do you think it is make a strong or powerful for every people here?
Yeah, so with regards to the international collaboration, we call it diplomacy, right? I think we heard Her Excellency Ibu Retno Marsudi did talk about the various collaboration at the TCA, the ASEAN level, at the regional level, even bilateral, right? This is one area where I think 2021, we see it will not stop. This collaboration will have to continue because one country itself will not be able to manage or contain the virus itself. So it needs to have ongoing, continuous diplomacy and really explore the weaknesses and the strength of each countries and see where we can partner and how we can actually work towards managing the COVID-19.
So for us, it's strong belief that our collaboration will fill the gaps, yeah, from every country who attend this meeting. Maybe we can share every kind of topics, and maybe also we can increase our thing about how to make the vaccination is one of main topic or main activity for every nation in the world. So also I would like to ask about what do you think the next step after vaccination? Maybe Ibu Shanti have like your opinion about this.
I think the next step would be to continue the collaboration. This is a good start, and to continue to ensure that we have the same protocol regionally at ASEAN level, at APEC level, because we need to maintain the testing within cross-border as well. I think that's an important element. So testing needs to continue while we roll out the vaccination site. Yeah.
Okay, maybe we have another friend here.
Yeah.
Our friend, Mr. Kusayan Syah. So Kang Kus, please, maybe you
Thank
have
you.
another
Thank you,
opinion.
Talia. Good afternoon, distinguished ladies and gentlemen, and also to all the participants of this discussion through participate through Zoom meeting. Let me introduce myself. My name is Eriansa, Vice General Secretary of Pajajaran University Alumni Association and Executive Director of Indonesia Fintech Lending Association. We are very grateful for the presence of distinguished ladies and gentlemen in this second days of international conference. Through this discussion, we try to find a comprehensive and in the same time effective and implementable solution for pandemic handling and economic recovery for Indonesia, for our lovely country and world and to the world. In this, I want to also allow me to thank our generous sponsor once again, from BRI, MNC, BNI, Uji Cepat, Kadika Capital, Paragon, Goodreads, Telkomsel. also to all the media partners to support us for this event. Bloomberg, Media Group, Metro TV, Media Indonesia, Medcom ID, TV One, Berita Satu, MNC, Sonora, Economic, Pikiran Rakyat, RMOL, Republik Merdeka, Farah, Unpaders, 1067 Mara FM, Raka FM, Rix.id, Jack TV. And also, I want to send a warm greeting to many prominent person. We have Kang Windratmo, Consulate General at Jeddah, and also Kang Andri Hadi, Ambassador of Republic Indonesia for Belgium, and Mr. Turkman from ISDB, and also to Kang Juliman from Bio Farma, Kang Andriansah from Bio Farma, Teh Sri Harsi from Bio Farma, Kang Tanon Arya Dewangga from Cabinet Secretary, Deputy of Cabinet Secretary, and also to Kang Andi Rahmianto, General Director of Protocol and Consular at Ministry of Foreign Affairs, and Mr. Kazuhiko Shimizu from Japan Embassy. And I think there are still many prominent persons with us today, and thank you for your togetherness to make this event successful.
Thank you for that. So we are now ready for our next session. The theme for this session would be Global Health and Vaccine Diplomacy. I now would like to welcome our moderator, Mr. Bebeb A.K. Nugraha Junjunan. He is the Director of Legal and Territorial Treaties from the Ministry of Foreign Affairs of the Republic of Indonesia. Mr. Bebeb starts his career in the Ministry of Foreign Affairs of the Republic of Indonesia in 1989. In January 2017 to present, he is assigned as the Director for Legal and Territorial Treaties at the Directorate General of Legal and International Treaties. During his tenures, he held important positions, mainly from 2016 to now as Chief of Indonesia's Technical Maritime Boundary Delegation. Before then, he served several assignments as Head Secretary for Indonesian delegations to bilateral, regional, and multilateral meetings, amongst others, which includes World Intellectual Property of Organization, World Trade Organization, International Maritime Organization. From 2012 to 2016, he is also assigned as Deputy Ambassador at Indonesian Embassy to the Kingdom of Thailand and UNESCO. Mr. Bebeb, the time is yours.
Thank you, Ibu Santi. It's been a pleasure and honor for myself to become part of this international conference, because basically this conference would give a very positive impact in what Indonesia is doing right now to approach on any efforts over this quite pandemic. Before I introduce the three panelists for today's session 2, which the topic would talk about the global health and vaccine diplomacy, I would like to reiterate some of the points that has been mentioned earlier by our Minister for Foreign Affairs, Ibu Retno Marsudi. Also, some of the points that I would like to underline to give you a brief information about what the three panelists would go forward as well, and then to what extent perhaps at the end the discussions would go forward. If you know exactly now that some countries has used COVID to enhance their soft power, namely when we talk about that, it's about China, Russia, India, now becoming a lead country in doing what we are saying as a vaccine diplomacy. Now, to some extent, we also would like to see how Indonesia could interact on how these conditions can be worth it to what Indonesia looking forward as what we call it a very independent and neutral country in the world. Now, to some extent, Indonesia is very strategic positions because within these global competitions, the enhancement of the vaccines of COVID-19 in the world is completely becoming a part of a political event. You can see some of the point mentioned in some medias saying that when we talked about fighting disease, has in fact long been used as a means of extending the soft power and winning friends. Some liberalists, perhaps for influence, some certain have been positive. For example, when the world get united when we are facing the 2002 SARS epidemic. But the big challenge right now, on our perspective, is how the big challenge, for examples like COVAX that has been established right now, can be successful tools if it is focused on equitable access. Some of the point I think when we talked about how to have a diagnostic, how to have a treatment, as well as the vaccines, because in particular to help less wealthy countries to get that vaccine. Now, the vaccine itself, if I look into some short research, is becoming one of it called the world most in demand commodities and become the currency for international diplomacy. Now, to some extent, for their reasons, I think our sessions today can completely look into several points how Indonesia, as the strategic country in the way how to fight against the pandemic, and then try to look how the WHO and then how the UNICEF can look towards that. So it is an honor for us today to have three panelists, which I would like to introduce one by one to each of you, that will enhance and enrich us on what the meaning of a global health and vaccine diplomacy can affect us in the near futures or perhaps in the long term. First, we are honored to have Excellency Secretary General of the Ministry of Foreign Affairs of the Republic of Indonesia, Mr. Cecep Herawan. Mr. Cecep Herawan was appointed as Secretary General on 19 June 2020. And previously, he was the Director General for Information and Public Diplomacy since September 2017, after finishing his tenure as the Deputy Chief of Missions of the Indonesian Embassy in Seoul from 2014 to 2017, and Head of General Affairs and Logistics Bureau before leaving for Seoul. He earned a bachelor's degree in law at the University of Pajajaran, Bandung, and awarded master's degree in economic law at the University of Indonesia in Jakarta. He joined the Ministry of Foreign Affairs in 1993 and has served at the permanent mission of Indonesia to the United Nations in New York and Geneva, respectively between 1997 to 2008. Most of his career as a diplomat invested on multilateral issues, particularly on sustainable development and environmental issues. Now, Pak Cecep Herawan is married to Vida Gadiranti and has a daughter. The second panelist for us today that is a very long time friend of mine when I was posted in Geneva. His name is Mr. Ludi Prapanca Suryantoro. I'm glad to see him here today. He's a head of multi-sectoral engagement for health security and international health regulation, World Health Emergency Preparedness of World Health Organization in Geneva, Switzerland. Mr. Ludi is a result-oriented professional specializing in high-level diplomacy and policy of health security, particularly on pandemic preparedness. Now, prior to WHO, he worked at the Secretariat of the Global Agreement on Tariff and Trade, or GATT, for the Marrakesh Roundtable in 1994. And from 98 to 99, he worked for the Secretariat of the Group of 15, where he was responsible for organizations, head of State Summit. He joined WHO in 1999, and from 2010 to 2016, he served as the senior political advisor to the Assistant Director General for Health Security. To date, he is the head of the WHO Multi-Sectoral Engagement for Health Security Preparedness within the Department of Health Security Preparedness of World Preparedness Emergency Program. He is responsible for strategic partnership for IHR and health security by strengthening and advancing the multi-sectoral collaboration and partnerships for country health emergency preparedness. He also, as the head of the MHS, responsible for facilitating strategic operations and partnership between and within member states along with regional and international partners and donors and networks aimed at improving and protecting global health risk. Our third panelist is Dr. Kunihiko Chris Hirabayashi. He is the UNICEF Regional Office for East Asia Pacific Regional Advisors and Chief of Regional Health and HIV Section. Dr. Hirabayashi has been working as a regional advisor in the UNICEF East Asia and Pacific Regional Office based in Bangkok since May 2016. He oversees and provides technical assistance and advises on broader health issues for children to the 14 UNICEF country offices that serve for 27 countries in the region. Prior to this appointment, he served in several positions. Along that plate is the director of UNICEF Tokyo Office for Relations with Japan, and then in India, and Lebanon and Afghanistan. And before joining the UNICEF, he worked as well as a technical advisor of National Center for Global Health and Medicine in the Ministry of Health, Labor and Welfare, and extended technical assistant. Long countries such as Bolivia, Colombia, India, Indonesia, Honduras, Uzbekistan, South Africa, and Vietnam for about 10 years since 1994. He earned an MD and a PhD in medicine from University of Tsukuba, Japan, and had worked as a specialized heart surgeon for 10 years in Children's Hospital and the University Hospital in Tsukuba. Ladies and gentlemen, dear participants, before I give the floor to each of the three great panelists for today, I think one of the points that I also would like to underline when the Minister of Foreign Affairs mentioned about the three critical aspects on how the urgency of international cooperations and collaborations he is addressed to the challenges. And I think those three critical aspects quite relevant when we talk about how she mentioned in the very first day, no one's in safe unless everyone is safe. So without further ado, I would like to give the floor to Excellency Mr. Cecep Herawan to give his presentation. Pak Cecep, floor is yours.
Thank you very much, Kang Bebeb. Kang Bebeb indeed is my senior colleague and also my partner in crime. Thank you very much, and thank you for having me here in this conference. Allow me to begin by expressing my sincere appreciation to UNPAD as well as IKA UNPAD for convening this very timely conference. Indeed, it is very timely since we are now in the midst of mitigating as well as adapting to the current pandemic. Distinguished participants, for over years, the COVID pandemic has brought a detrimental impact on our economy, health, and basically every aspect of our lives. As mentioned earlier by Minister of Foreign Affairs of Indonesia, today there are more than 111 million global cases in 223 countries. Certainly, the challenge brought by COVID-19 are immense and unprecedented. Not to mention the emergence of new variants of the virus while it continues to spread. The COVID-19 pandemic has forced us to extra miles. Measures had to be put in place to effectively deal with both our domestic needs and situation, as well as strengthening international solidarity and cooperation to mitigate the pandemic. Distinguished participant and colleague, due to these enormous challenges, and to a certain extent, we also need to adjust our diplomacy. In responding to pandemic, Indonesia diplomacy has been refocusing into three priorities. First, by protecting Indonesia citizens. Second, addressing the pandemic itself and mitigating socio-economic impact and contributing to global health resilience. What I mean by diplomacy is not exclusively conducted by the Ministry of Foreign Affairs to our diplomats, but through close collaboration with other stakeholders. On the protection of our citizens, until today, the Ministry of Foreign Affairs and our mission abroad have assisted around 3,270 Indonesian overseas that have contracted with COVID-19, spreading out in 80 countries and 31 ships or cruise ships. So far, we received information this morning that 250 Indonesian has already recovered, while unfortunately 171 of our fellow nation are dead and 749 is still under treatment. Based on the data this morning, we received a new cases for Indonesian citizens who are affected by COVID-19 in Peru. Furthermore, we have assisted in the evacuation of our nationals from foreign countries, and to date, more than 182,000 Indonesians have been repatriated from all around the world. 132,881 Indonesians have been repatriated from Malaysia, while the others is mostly from the Indonesian who works in the cruise ship, more than 27,000. Certainly, we shall continue assisting and protecting our citizens overseas in overcoming this COVID-19 pandemic. Allow me in this occasion also to pay a tribute to our colleague from the Indonesia Armed Force, the police, as well as the task force for the COVID-19 and the Ministry of Transportation and other stakeholders who indeed giving us a very constructive and good collaboration in our effort to protect our citizens, in particular when are in the process in repatriating our citizens to Indonesia. The second, our diplomacy is now geared to support the efforts of the government in mitigating the pandemic and its socio-economic impact, certainly through the international cooperation. At the early stage of the pandemic, every nation was in dire need of medical equipment and therapeutic medicines, which led to scarcity of medical equipment and medicines, thus incurring a disruption of global supply chains. To thrive to adapt for the short term, our diplomacy is aimed to fulfill domestic needs for medical supplies, therapeutic, and vaccine. Meanwhile, in the long term, our diplomacy is aimed at strengthening our national health security. Through domestic efforts, we are also actively participating in global efforts to end the pandemic, to contribute to the global health resilience. Therefore, at the early stage of the pandemic, we are focusing our effort to fulfill immediate needs for medical supplies and therapeutic through the cooperation. I still remember back in the early March 2020, we have indeed having a very good collaboration with our colleague from South Korea at the time for the joint production of the PPEs, the personal protective equipments. Yes, Indonesia is one of the largest producing country for PPEs, but unfortunately, all the product being made by Indonesia, the raw material coming from in this case coming from the Republic of Korea, South Korea. So we are trying to fulfill our needs for the PPEs at the time, and we are in close collaboration with the government of Republic of Korea and on how to secure the raw material coming to Indonesia, so to enable us to produce more PPEs, both for domestic use as well as for other partner, in particular Korea. Similar collaboration also conducted with our colleague from India and Japan to ensure the supply of active pharmaceutical ingredients and medicine for COVID-19 therapeutic. And with the United Arab Emirates for the procurement of COVID-19 diagnostic and screening tools. We also try as much as possible to fulfill our national needs by achieving international certification of ISO 16603 and 16604 for Indonesian meat raw material for the PPEs. Now we come to the long term. In the long term, we need to strengthen our national health security by supporting a strengthened health system through advancing research and development in vaccine development, end-to-end vaccine manufacturing to become regional hub. Currently, Indonesia has only a number of vaccine manufacturers, and biopharma is the biggest one. Supporting establishment of national active pharmaceutical industry and critical base herbal medicines to reduce dependency of pharmaceutical import and to enhance Indonesia's self-reliance on active pharmaceutical ingredients and medicines. Through this pandemic, we just realized that as of 2020, Indonesia import more than 90% of its active pharmaceutical needs at the value of 4.8 billion US dollars. So to a certain extent, this pandemic also opened our eyes on the need for us to strengthen our national capacity, in particular in the health sector. At the regional level, Indonesia and other ASEAN member states are developing the standard operating procedure, as Ibu Menlu already mentioned, on public emergency, as well as the COVID-19 ASEAN response. To assist members in mitigating the pandemic by providing medical equipment and therapeutic. And the regional strategic action plan for ASEAN vaccine security and self-reliance to urge for vaccine security and self-reliance amongst ASEAN member countries. In various multilateral fora, including G20, Non-Aligned Movement, OIC, and other informal high-level meetings, Indonesia consistently pursue and call for importance of fair, timely, equitable, and affordable access to medical equipment, therapeutic, and vaccine. For all, Indonesia is one of the first countries to initiate the UN resolution on global solidarity to fight against COVID-19. Indonesia also chaired the Foreign Policy Global Health Initiative in the year 2020 that promote affordable healthcare for all. Distinguished participant, colleague, vaccine is one of the solutions to start recovering the COVID-19 pandemic. Diplomacy has opened path to secure access to vaccine, both to bilateral and multilateral tracks, safe, effective, and affordable vaccine, and actively participate in multilateral cooperation to ensure fair, equitable, and timely access to vaccine. Now on the bilateral track, through the process of vaccine and more than 22 million doses of health vaccine from Singapore has been delivered to Indonesia. And yes, this is partly also due to strong collaboration and support from the government of China. As a matter of fact, our ambassador in Beijing is the first foreign ambassador to visit Sinovac facilities during the earliest days of the pandemic. Through this effort, we started cooperation not only on procuring Sinovac vaccine, but also in technology transfer. The Ministry of Foreign Affairs will continue to support the government efforts in securing more vaccine from various manufacturers around the world, such as from AstraZeneca from the UK, Novavax and Moderna vaccine from the US, mainly to fulfill Indonesia's vaccine needs. Vaccine diplomacy is not only meant to fulfill national needs on vaccine, but also to ensure the access for safe and efficacious vaccine of other especially for the most needed. To that end, Indonesia is committed to participate in joint effort to fight the COVID-19 collectively. Through this multilateral track, Indonesia is also actively participating in the COVAX facility, a global initiative to deliver safe, fair, and timely vaccine to all member countries to help securing access to vaccine for 20% of population of its members, including Indonesia. As already mentioned by Ibu Menlu, that Indonesian Minister of Foreign Affairs has been selected as one of the co-chair for the COVAX facility AMC 92 engagement group, alongside with the ministers from Ethiopia and Canada. It shows international public trust towards Indonesia to co-lead the global solution to this pandemic. Indonesia also supported WHO's access to COVID-19 stool accelerator and WHO COVID-19 technology access pools to ensure again a fair, timely, and equitable access for vaccine for all. Distinguished participants, colleague, Indonesia currently also actively participate in the Coalition for Epidemic Preparedness Innovation, or CEPI, which is aimed at filling critical gap in vaccine ecosystem to mitigate emerging infectious disease in the future. CEPI is funding and supporting research and development and manufacturing of COVID-19 vaccines for the platform of DNA, mRNA, viral vector, and protein recombinant. Last year, Indonesia has made a contribution to the coalition or CEPI at the value of $1 million US. Indeed, this is a modest contribution by Indonesia. However, to this contribution, Indonesia became a member of Investor Council for 1 year period. This membership will allow us to access to the global network of vaccine research and development and manufacturers network, as well as provide us an opportunity to engage in a strategic partnership in the cooperation and co-production of vaccine for future potential emerging infectious disease. Indonesia support the role and contribution of CEPI as a connector and enabler, not only in the early stage of research and development, but also the late stage of manufacturing technology to scale up the production, and proposing three main issues to CEPI. First, Indonesia urged the importance of concrete engagement of low-middle income countries, especially in the process of preparation for second wave of COVID-19 vaccine, in which Indonesia could be the production hub of vaccine, particularly for the halal vaccine. Second, Indonesia encourages cooperation between CEPI and governments for a joint campaign emphasizing strategic law on multilateralism and CEPI in mitigating the pandemic. Third, Indonesia will support the engagement of CEPI during the chairmanship of Indonesia in G20 as well as ASEAN. COVID-19 pandemic has brought detrimental impact worldwide. It is required a global collective effort to end such unprecedented pandemic. Distinguished participants, ladies and gentlemen, there are many lessons that we can learn from this pandemic. This is time for Indonesia to work harder and coordinate efforts to suppressing further transmission of COVID-19 and overcoming the domino effect of this pandemic. Well, Pak Bebep, that's my presentation, and thank you very much, and looking forward to the discussion later on. Thank you, Pak Bebep.
Thank you, Pak Cecep. That would be a quite what we call it informations, direct informations to what extent that Indonesia has done so much in a very short time, believing into what we need in the future to fight against the pandemic and how diplomacy could work it out. Thank you, Pak Cecep. Before I continue to give a floor to Mas Ludi and WHO, I missed something to inform the panelists that the time is 15 minutes. I was about to say to Pak Cecep, but because he's even my boss on after office hour, sorry, in office hour, but this is not office hour, so I can also say to him the time is limited, but we do it on a later stage. So, Pak Ludi, the floor is yours. Thank you. And 15 minutes. Thank you.
Thank you very much. Thank you very much, Pak Bebep. It's been nice to see you again as the moderator, and I feel very honored to be here. Congratulations to the University of Pajajaran and also ICA for organizing this important meeting. I'm asking the organizer to share my presentation, or
You are a co-host. You are already a co-host, so you can share. You can do your share screen.
all right. Let me just. Can everyone see my screen right now?
Yes, we can.
Okay. So thank you very much for this opportunity. So over the next 15 minutes, I would like to raise the issue what the minister as well as His Excellency Pak Cecep already mentioned. My focus discussion here is about building back better by strengthening multi-sectoral engagement for health security. As the previous speakers already mentioned, and yesterday's already mentioned, that we are in the different type of engagement right now. We are still responding to the pandemic. But I guess there's so many lessons learned that 2020 has provided us, but I would like to focus our discussion for that multi-sectoral engagement. The objective is that, the COVID-19 has revealed every country is vulnerable. So the minister is already saying that, no one will be safe unless everyone. And the capacity required a strong multi-sectoral and whole society, whole government approach. The world needs political commitment as to ensure the interconnected for health, multi-sectoral preparedness for health security. So first of all, I would like to applaud all the WHO member states for passing and adopted the WHO resolution. This is a key milestone for WHO in strengthening preparedness for health emergency, particularly in accelerating the implementation of the international health regulation. For those who's not very familiar about this regulation, is one of the legal legally binding framework signed by all countries of the member states of WHO in building and sharing information for any potential of the public health events of international concern. In this resolution, the member states recognize on stressing the importance of the multi-sectoral coordination, inclusive approach, and all hazard, all policy, all society for health security. Now, as we are currently in the responding mode in terms of the COVID-19, WHO has issued the Strategic Preparedness and Response Plan in 2020, but is continuing to adopt the response plan in 2021. And the focus is really to suppress the transmission, protect the vulnerable, and saving lives. And we have issued several of the strategic plan and shared to all member states, to donors and partners. The angle of the strategy right now, we are focusing into different pillars. And one of them is, of course, is about the vaccines, but not limited. There are laboratories, there are issues about surveillance that we would like to enhance. But infodemic, this is an important area where we need to make sure that all countries receive the right information by the right sources. We focusing in the cross-cutting issue on coordination and planning as WHO serve as the convening power for member states and partners. Operational support and logistics will continue to do that, as well as accelerated for research and innovation. As what Pak Cecep and the minister is already saying, that this is just to give you a broad worldwide effort to develop and deploy advanced COVID tools across vaccine therapeutics and diagnostic. As you can see that the CEPI, the Gavi, WHO, but not limited also to these organizations such as UNICEF, but it's also World Bank in the context of health system connectors, diagnostic. We have a fund and the Global Fund, but it's also research such as the Wellcome Trust in the UK, Bill Melinda Gates and UNITAID in leading the therapeutics efforts. Why do we need the COVAX facilities? And I think the ministers has provided a very good foundations on why we need to have this solidarity, because no one will be safe unless everybody's safe. And also bilateral deals leave many countries left behind. And this is against what we have in the SDGs. As today, it is a very historical moment. In my 20 years of working, nearly 20 years of working in WHO, I was there for the SARS, I was there for the Marburg outbreak, I was there for H1N1, and I was there also for the Ebola and the Zika. And as you can see that, you know, the time is getting closer in terms of the potential public health risk. So it's in the region about 5 years in each of these events. So once again, COVAX is providing a platform, and this is an important mechanism, as the minister is already saying, and also can save the, you know, protect the economy. As you can see that 365 billion loss globally, the economy in each month, that it shows a very high concern of balancing between saving life and also protecting economies. Now, I would like to go back a little bit what I said earlier regarding international health regulation. Under the international health regulation, as the key focus is about preparedness here, is about the IHR monitoring evaluation framework. And this would include the state party self-assessment, so the government will assess about their capacity prior to the COVID-19, and this has been done for the last 20 years or so. After action review is the tool that we provided for the member states in reviewing about the lesson learned, what pandemic has brought them together. Simulation exercise, sometimes you need to make sure that the system will work, the structure is continued to be improved, and we provided that support to countries who would like to do the simulation exercise. And the fourth one, what we believe in terms of how country-to-country collaborations under the article of IHR 44 is really encouraging countries to countries collaboration in terms of public health emergencies. And the voluntary external evaluation is a peer-to-peer review in assessing the capacity of the government and other key actors within the government in order to prevent, detect, and respond of potential future pandemic. And below is all the information related what the guidelines that we already produce. So prior to the COVID-19, how all the member states are reporting to WHO in terms of their level of preparedness? In this slide, as you can see that, you know, each of the technical areas such as risk communication, health services provision, financing IHR, emergency resources, biosafety, biosecurity, human resources, and point of entry. This would create a summary of the average score of all member states of WHO reporting in the context of the international health regulations. What is interesting is that countries who scored better, and mainly in the developed countries, are also struggling with this pandemic. So with that view, the scoring does not mean that you are safe, and the pandemic does not mean it's only for developing countries, but it would affect those who are in developed countries, and everyone is vulnerable. In order to build better and a longer-term health system preparedness in the COVID-19 as well as beyond, WHO looking at different strategy in terms of handling the COVID-19. So one is the area of work regarding the response. So we have the response focused department that is leading on the issue of the current response of the COVID-19. Preparedness and readiness. So this preparedness and readiness is to make sure that the member states can be supported and capacitated in terms of their readiness operationally, and looking at specific areas that needs to be enhanced or that needs to be adopted further for the COVID-19. And then the preparedness and sustainable capacity for preparedness is something that we would like to make sure all member states will invest in the preparedness as national, global, regional preparedness is the key for the future handling of the pandemics. The approach for preparedness, it has to be in the context of the One Health. As you know that most of the public health emergency events is originated from animal diseases. So the One Health approach to the IHR is strengthening, including in zoonotic diseases and preparedness and scale up that country capacities. In the One Health capacity assessment, which is linked to the joint external evaluation showing critical gaps in coordination, zoonotic disease surveillance, as well as veterinary workforce. Another key pillar and fundamental for the multi-sectorality, we are in the midst of this COVID-19, we're introducing another tool called intra-action reviews for the COVID-19. These tools and this guide is support countries to reflect the ongoing what works, what doesn't work, where it needs to be improved, and which area needs to have better support. We applauded the country, including Indonesia, to initiate this intra-action review together with Thailand, Uzbekistan, South Africa, and Nigeria. And we have been last year, a virtual meeting with the minister regarding sharing information of the current operation of the COVID-19 response. Urban preparedness is another issue that needs to be enhanced because cities are in the front line in terms of point of entry. And we recognize that many cities is not well prepared in the context of public health emergency. They're very well equipped on the natural disasters, but the pandemic is something really new. In fact, in 2018, together with President Macron of government of France, we have initiated the high-level conference and also attended by Indonesian delegation in this important meeting. The meeting is focusing on preparing public health emergency and challenges in the urban areas. In 2020, we introduced the interim guidance and checklist in strengthening preparedness in cities. But we are also building and launching this year of the potential global city network for health security. So I think local authorities, the national authorities needs to be aligned. We've seen that surging and enhancing the local authorities to have a better preparedness in the future will be one of the key fundamental solution for us all. Now, the current IHR and the current process of what we call it voluntary or joint external evaluation is not sufficient, or is not addressing to the current challenges under the COVID-19. Under the direction of our DG, is calling for a universal health and preparedness review to build mutual trust and accountability by bringing nations and neighbors to support whole government approach. So once again, preparedness is the center. It is guided to the lesson learned of the pandemic and the recommendation, what we call it, the IHR review committee. In addition to the IHR, the head of states currently is proposing several member states are gearing towards the International Pandemic Treaty. As you know, one of the key issues that maybe the world needs to know that, and also supported by the Minister of Foreign Affairs, Her Excellency Ibu Retno, regarding the importance of multilateralism. The International Pandemic Treaty is focusing on building national and regional global resilience to the pandemic. This is the key solution for the future. Facilitating collective international effort to prevent, detect, rapidly detect and respond to outbreak, and also ensuring that universal and equitable access to countermeasure pandemic preparedness and response. So once again, this is one of the ongoing discussion and debate within the WHO member states, and we understand that several member states are pushing forward in terms of the establishment of the International Pandemic Treaty. What WHO efforts so far in the multi-sectoral preparedness coordination framework? We issued the multi-sectoral preparedness coordination framework by providing all the model and the case studies of country who has a better coordination between key ministries, but is also not limited to ministries, but is inclusive all key actors, for instance, NGO, local NGO, private sectors, in terms of sharing values and sharing responsibility in preparing better for the next challenging and complex of future pandemic. One of the key turning points in the engagement of non-traditional actors from health. As you know, WHO is main member states and main interaction is with Minister of Health, but it's not lately limited to the Minister of Health. We're also engaging with the Minister of Foreign Affairs, Minister of Interior. In 2017, we engaged with the military health in collaboration with the International Civil Military Medicine in terms of how the two sectors can build better coordination and better collaboration at the national level. And this meeting was initiated in Jakarta and opened by the President Jokowi. Another effort that we would like to engage further is engaging with the parliamentarians. In collaboration with the Interparliamentarians Union, an organization specializing in this area, WHO is launching very soon a joint handbook on the Parliament's role to strengthen health security. I think this is one of the key issues in terms of advocating to elevate and for the Parliament to understand better on how to do a domestic investment, that health is not an expenditure, but health is a real investment. And also to get a better understanding about the right and obligation of the international organization itself, and also international treaties, committees that is affecting, influencing the future country preparedness, and turn that preparedness into a key action together with the parliamentarian. The other tool that quite considered important is about resource mapping. We provided this access to all countries, and in this case, I'm showcasing a country, Nigeria. This portal is available, and we can support further the implementation of this tool in Indonesia, for instance, or for this country are interested with this tool. What the tool does is providing a whole picture about who's doing what within the country. And most importantly is looking at how many partners and internal domestic financing as well as external funding. In Nigeria, we're mapping around 156 million that is currently available, but it's also we help Nigeria to mobilize further with international partners by bringing 66 donor partners in the country. So available.
Yes, can you just go to the conclusion?
Thank you. So the last messages that I would like to bring is that we need to enhance and reimagine our leadership about building mutual trust. I think solidarity and equity will keep us all safer. The access to COVID-19 tools accelerator is a health diplomacy in action. Vaccine equity is a reflection of solidarity, but it's also global health diplomacy. In going forward, we would like to continue and strengthen the multi-sectoral engagement for health security and further to support country to better prepare for the next challenges. With that note, I thank you, Mr. Bebek. Thank you.
Thank you, Kamasudi, for your comprehensive presentations, which give us a little bit more enlightenment issues of what has been taken care globally, in particular WHO as one of the most important organizations for now in overcoming the epidemic. Thank you for that. And I would like to give the floor to Dr. Kuniko Chris Hirabayashi. Dr. Hirabayashi, the floor is yours.
Thank you very much, Chairperson. And it's very great pleasure for us to giving us the opportunity to share the UNICEF perspective. And The COVID-19 has many aspects, as Her Excellency Minister mentioned. Poverty is rising and inequities are growing, and the pandemic has disrupted and many essential services, including health, education, protection, particularly targeted to children and young people. The COVID-19 pandemic is not just a health, social, and economic crisis, but also we should say a child right crisis. So that is what today I try to bring some global regional health view, as well as some child rights perspective of this pandemic, how urgent action is needed for the future for children. This is my purpose of presentation today. And one of the example of impact to children is mainly school closures. Of course, school closure can be some of one of the effective public health measure. However, school may not hub of transmission. So many countries still using a school closure as a measure of controlling transmission. UNESCO in December 2020 estimated classrooms for 1 in 5 school children were closed. Still in February, there are many children are not able to go to school, so they have to educated from remotely or other broadcasting measures. And in the matter of fact, in 2020, in East Asian Pacific, such closure have affected more than 325 million children. And even in January 2021, because of surge of coronavirus, school closures happened again in Malaysia, Mongolia, Myanmar, and Thailand. And also UNESCO particularly estimated at least 2.7 million children across the region will not return to school even once they reopen, because they're already very far from education and they cannot come back to school easily. So the pandemic itself is very huge risk for child rights and also a future of children for this region. And for UNICEF, of course, COVID-19 may not so targeting children's health. However, COVID-19 vaccine can help so many areas of child rights. For instance, even a very limited vaccine availability situation, like 1 to 10% national population coverage, the vaccine can target health worker at high risk, and also old and adult by age-based risk. So meaning health system can reduce their mortality of deaths and also protect the health worker, meaning many children can go to health service like immunization for women antenatal care and safe delivery at hospital and postnatal care. This is a huge impact for children's life. And even the second scenario, up to 20% population, even a very small number, not able to contain the pandemic, still many benefit, because the group with comorbidity and also some social demographic groups are protected, and also high priority teachers such as preschool teacher or primary school teacher who are not easy to able physical distancing with children can be protected, meaning children have more access to social service, particularly for education. So even 20% population coverage by COVID-19 vaccine is a huge impact for child rights. So that is why UNICEF is very actively engaged this COVID-19 vaccine introduction and vaccination. As other panelists already mentioned, COVAX is a very important platform. It's one of the global collaboration platform to equitable access to many things, but COVAX very focused on the vaccine. And the UNICEF's role and is not only for just to introduction, but also as working as a supply related coordinator in COVAX. And UNICEF can, on behalf of 82 COVAX AMC country, there are 92 COVAX AMC country, but 10 is PAFO, American Health Organization taking care of the 10 American country. So UNICEF can take care about 82 COVAX country on behalf of their country to procure the COVID vaccine. And also UNICEF offer to procure on behalf of full financing country outside America that seek procurement support through COVAX. And also UNICEF is heavily or actively engaged with like a manufacturer to reduce transaction costs for participating countries. So not only vaccine, supply related one, including PPE and some commodity and the testing. This is UNICEF how can contribute globally. And this is a COVID vaccine supply agreement by receipts. This is I extracted this data this morning from UNICEF dashboard. There are several data discrepancy I know between some like Indonesia. However, this is UNICEF obtaining information. So please allow use to this information to having kind of global comparison. And the European group of European country, European Commission secured more than 2.1 billion vaccine. And Indonesia around 340 million. And among top 10 country or region in the world, and followed by Japan. And the COVAX at this moment 1.1 billion vaccine are secured. So meaning still many inequitable distribution obvious in other like middle income or low income country. And by vaccine supply agreement by vaccine developer, so AstraZeneca and the Novavax and the Pfizer vaccine are leading manufacturer to have a signed agreement. However, only AstraZeneca, Pfizer vaccine are listed emergency use by WHO. So the country has no capacity to bilateral deal or not yet emergency use authorization, very relying on WHO's emergency use listing. So only two vaccines can be accessible. So there are several regulatory barriers exist for those countries. In pricing, there are also very dependent on countries' negotiation capacity. And like a COVAX AMC can secure very affordable prices, like $3 per doses. So that is why COVAX is very important instrument to provide a secure and the safe and efficacy and equitable distribution. Like India, there are several two market prices. One is for public purpose and the other private market. There are around $10 doses differences. Some company like Moderna is selling a little bit high prices to a high income country, like a $30 doses per doses. So those prices may not affordable for non-purchase power income country. So COVAX is very important role to support on behalf of those countries. And if we go into very deep dive in Southeastern Asian country, this is a COVID-19 vaccine securing doses per capita. This is including through COVAX facility, but also outside COVAX bilateral deal. There are several discrepancy data between some country has, but this is information come from UNICEF supply division. And if population coverage term, some vaccine is only one doses. So there are several differences, but for Malaysia, Indonesia, Philippines already secured more than half of their population by vaccination. And Thailand, Vietnam, and somehow close to 50%. Myanmar is currently a political turmoil, so even secured vaccine may not easy to reach to the community. But Laos and Cambodia still less than 10% secured coverage, even supported by COVAX. The issue is like Laos, PDL is heavily relying on COVAX. This is much more deep dive to each country. This is Cambodia, 50% secured by COVAX and 50% come from donation from China. And also individual bilateral deal with AstraZeneca around less than 5%. For Myanmar, it's more predominantly for Serum Institute of India. Maybe this is like a global regional diplomacy a kind of a manifestation. However, but those regional diplomacy also important to support those vulnerable countries. And UNICEF see neonatal mortality rate as compared with GDP is trustful or sensitive proxy indicator to evaluate each country's health system responsiveness. So like Myanmar, Laos is very high mortality as compared with their national GDP. So meaning those access is not appropriate accessible country has a weak health system, meaning those countries may not easy to contain health like COVID-19 without vaccine support for global coalition. So somehow we really need to attention to those countries in terms of health system vulnerability. For other countries, there are several or very different type of vaccine development policy. Like Thailand does not attend the COVAX, and Vietnam using more Sputnik 5 vaccines. And the Philippines has a very diverse vaccine portfolio, like a 6 type through 7 channel. And this is also very important because of this unforeseeable situation of availability. And also when the vaccine comes, that somehow is important like a national security policy, health security policy. However, this very diverse vaccine portfolio may be difficult having a kind of a training for health workers. In Malaysia, Indonesia also has a unique vaccine portfolio. And Indonesia definitely the first runner and is running a country for every ASEAN country because they already introduced many vaccination to medical health workers. So, however, this is also a diverse vaccine portfolio can be run from other countries. The vaccine affordability, accessibility is not just one important factor, but also from deployment to vaccinations, there are so many barriers in low in middle country. Like for middle income, low in middle country in this region, still very difficult to know what type of vaccine, how many, when available. So meaning estimated budget to also difficult, which funding sources available, and how about next year? Because the COVAX still designed for 2021 only, so there are no indication beyond 2021. And also many low and middle income country lack the capacity to adequately estimate and map appropriate target population, such as older age group with comorbidity or specific health conditions such as disability. So even their targeted population estimated, but very difficult to know where they are. And also vaccine distribution and storage is okay in a cold chain system. However, they are very difficult to having a robust communication between province and the district and village. So there are many barriers for communication for vaccine deployment, vaccination to the people. And also vaccine monitoring and the response are still very key. The many people demand to be vaccinated. However, still unmet needs is very, very heavy, but also increasing vaccine hesitancy due to fear of a side effect, also very difficult to manage once it happens. So there are many, many bumpy ways to from deployment to vaccination to the community. And this is reported vaccine production capacity by each vaccine type. And now we have around 6.8 billion vaccine may be available globally, but still not enough to cover enough population globally. So it's likely the full coverage by 2022 or 2023. So this is like economist intelligence unit estimated when the more than 70% population coverage can happen by country. So majority United European country in the USA may be covered by late 2021. And some OECD countries like Japan and Australia maybe by mid of 2022. But it is estimated in ASEAN country and the majority African country may not be a fully coverage by 2020 or even beyond 2023. So there are still vaccine availability to enough cover, more than 70% coverage is very challenging. So we need to see the scenario of 2021 with COVID-19 still influence on our society. So in this situation, like if another lockdown happened, the UNICEF survey found that the 60% of country reported disruption in the antenatal checkup and 59% in postnatal care. So many mothers, the parent, child care maybe hesitate to go to the health facility because of lockdown and also fear of being infected. And in the Philippines, as a matter of fact, and since lockdown, only 30% of 4 years old has a visited health care facility. And according to our Indonesian country offices survey, and we ask children, what is the situation in your education? And less than 50% of children in rural area in Indonesia responded, I have no computer to use for home-based education. And also 35% children mentioned that poor or no access to internet are main challenging for learning at home for me. And 31% of their parents say lack of direct interaction with teacher are major challenge. And also Indonesia teachers themselves say only 13% received the training or utilizing distance learning tools. So if the lockdown still continued into 2021, 2022, we need many things to take into consideration. And our Thailand controls teams also asked the young people Thailand, what is the most pressing issue right now since lockdown? And 85% young people say, I'm very afraid of financial status. And 75% young people say mental health issues is my most important concern. And also stopping education is my biggest problem because we cannot get a good job. So many issues, many implications for children and young people if the situation continue in 2021, 2022. So, yeah. This is that's right, and this is from UNICEF's perspective as a Indonesia chairpersonship G20 2020 and ASEAN chairmanship for 2023. So many ICA, UNPAD, and Kadin, ICCI, Indonesian political business and community leader can help globally, regionally. One is particularly for equitable distribution, fair distribution, the key, like Minister said, no one safe unless everyone safe. So definitely Indonesia as a key actor and COVAX and CEPI and ASEAN G20, definitely a champion to advocate fair distribution vaccine up to the last mile. And also particularly for some countries, ASEAN, they are still very challenging to access and the weakness health system. Indonesia, as a chairpersonship ASEAN 2023, can be a strong champion to enhance regional cooperation within ASEAN. And also, I already mentioned the hesitate vaccination is a key key risk to be vaccinated up to 70%. So Indonesian leader, political leader, community leader can be a champion to build trust in the vaccine and encourage being vaccinated for everyone. And also business leader particularly can be a champion to scale up family-friendly policy because there's so many stress among young adult, young family because of this COVID-19, such as family-friendly spaces, more like a flexible working hour for young people who needs to take care of their children during the school closures. And also Indonesia can be a strong champion, ensure all the children learn, particularly by closing the digital divide, because the digital technology maybe help other way around. So maybe for new normal, definitely the Indonesia can support those transformation for education.
Right.
And lastly, not least, and particularly for mental health is the issue. So Indonesia can be learning and is the good champion for supporting mental health, particularly young people. And thank you very much. And UNICEF will always stand with you and in your effort. And we really rely on Indonesia's leadership for this year and the next year. So thank you very much. And
Thank you, Dr. Hirabayashi. I think that will be quite clear enough that the most vulnerable one, not just for today's event, but I think for the future references, is our children. And I think the way how you make a sort of like relevancies on data or documents and so forth, that perhaps the vaccinations could be, more focused on how this could be directed for our future humanity and humankind. Well, thank you again for those three panelists who gave us more quite an enrichment of how one country, for example, Indonesia, would really like to play a key roles on facilitating that the context of guaranteeing the access and distributions of the vaccines is through a multilateral coordinations and collaborations, which will play a key role. And I think the WHO, UNICEF, and perhaps almost all the organizations can compare to what extent that these collaboration and coordinations can work forward. Because the international effort, I think, when I look into the three panelists, as well as underlining what the president said, what the minister said, that most of it is about how we can survive through this vaccine, the distribution, the access, for building again or developing again and fostering the economic recovery. So at the end, it will be economic. And the way how we worked out, I think is quite relevant. So a very impressive panelists for today's. And since we only have about 15 minutes for Q&A, I haven't seen people or participants extending their questions, but I do know there is about 305 participants today, which is following our discussion on session 2. While we are waiting for maybe 1 or 2 questions, we would like to use the much of these 15 minutes. Perhaps I can just give you, for 3 panelists, one of their views in the context of how the perspective could be relevant. In the early stage, I think the presidents mentioned 3 points. One, that it needs to have the eligibility of access for vaccine. And I think each country almost playing that role. Secondly, how public access should be opened by governments. And to some extent, when we see the governments, and at the early sessions, I mentioned about this vaccine becoming what we call it the currency for international diplomacy. And the way how they work it out is quite clear. India, for example, China, and then perhaps it was mentioned again, India, China, and Russia has playing very well. And Dr. Hirabayashi has clearly mentioned about how those, productivity of those countries are coming down to the directions. And then the last point is that when we talked about the COVAX, how the successful COVAX could do, I think Indonesia already been mentioned clearly that we are committed. We are trying to put ourselves on that extent. But how we see again on preserving that nowadays, this access and the global distributions of the vaccine is still reflecting a soft power, is still reflecting that they would like, instead of responsible to what that we have been discussing these sessions, but mostly to winning friends. At the end, of course, it will be talking about economy. So those perspectives that perhaps I would like to hear from each of you, your personal or your perspective on that. So perhaps I will just start with Pak Cecep.
My apology, Kang Bebep. Just now I'm in the middle of communication with the Vice Minister. I'm so sorry.
Okay, Pak. Let's give to Dr. Hirabayashi first, and then Mas Rudi.
Thank you very much. It's a very tough question for UNICEF. So it's not the organization position, but more my personal perspective. Of course, this in the beginning, I see that this like a soft power or vaccine diplomacy can be one of the struggle. However, if well coordinated and if the person or the involved this soft vaccine diplomacy can stand for trust, unite, and solidarity that His High Excellency mentioned, and also and based on the like kind of solidarity, maybe one of the that can be the one of solution. However, my feeling is still COVAX is very vulnerable because of accessibility, and also there are many layers put on by manufacturer like indemnity and regulation, the huge barrier for access for those developing countries. So maybe global community can support, and COVAX can be much more empowered, and also can be representing those most voiceless peoples. And that is why better to support COVAX as the champion or symbol of global solidarity for the time being. Even other vaccine diplomacy can support like a compensational kind of a role, but still there should be COVAX put on the most important milestone, having a global solidarity. And the multilateralism is also challenging how this multilateral arrangement can work for the future for new era. So that is why we really need to think about this COVAX success is a key for future for children. That is why I think it's much more important to put on the COVAX as our symbol of global solidarity. That is somehow we need a kind of spirit, and also vaccine solidarity, vaccine diplomacy can be like an alternative role in case the vaccine may not easy to come. So like a filling the gap type of approach. So maybe several kind of a well-structured idea needed for in this like a diplomacy.
Okay.
Just my question.
Thank you, Dr. Rashi. I think that's quite a good point that you mentioned about that. I think COVAX now is, even though still in the sense of yet to be stronger enough to be pushed forward, but I think this is the way how we should do it for the time being. Thank you for that, Mas Rudi.
Thank you, Pak Bebep, and also I second Rabashitang point of view. From the WHO, I think this is, we need to remind everyone that, we're having a novel virus. So this is a new virus that we are facing here. So I think all the world is, getting by surprise in 2020. And the fact of the matter is that we've been very consistently encouraging member states and partners and other international organizations to enhance the preparedness. One of the issues is that I think COVAX is improving, and I think, getting the production in place, and allocation is ongoing as well. But I think one of the key issues on the preparedness, I would like to go back in 2005. I'll give you an example. In 2005, WHO supporting various national manufacturers to strengthen their national production capacity. At that time for influenza, and in fact, we are helping biopharma at that time with a technology transfer. However, as this is not considered as an investment by the global community in this area of health security, it gets somehow stopped, this project. The 9 manufacturer and biopharma, one of the big, advanced manufacturer for the technology transfer, together with Serum Institute, PCI, and also IVAC in Vietnam. So I think the International Pandemic Treaty will address some of your questions in terms of how we can balance between the vaccine nationalism, the geopolitics that is coming into place. But most importantly, I think the core of the issue is also about economy. The pandemic, financial policy for pandemic is not existed. Our collaboration with IMF and the World Bank is looking at how we can make the market continue and recover quickly, knowing that we are going to be with the COVID-19 for a while. So I guess the multi-sectorality issues is becoming an important one. The fact of the matter is that no single institution can lead internally at the national level for pandemic response. It requires a very strong and robust, from legislation point of view, from the operational point of view, and also from the resources that is available. Solidarity, yes, I think the world is solidarity, and we need to emphasize through Indonesia leaderships in different fora. For instance, the G20 is already pledging $4 billion for the closing the gap recently for the COVAX facilities, and this is something that we need to have the funding mechanism contingency in the future for a pandemic preparedness, and also in the context of legislation. I think preempting on the collaboration with with member states and the manufacturer required a very robust discussion prior and way before, and we did that. We tried with that with the influenza vaccines during the European Commissions of having a pre-agreement with the national or with international manufacturer in terms of productions. So I guess the government policy, international organization continue to learn and continue to adapt of what the COVID-19 bring us, and the variants that is happening in different countries. I think this is something that we can bring back into how the collaboration regionally, globally, and the initiative that would not overlap. Indonesia has the foreign policy and global health issues that is leading at the UN Security Council. I think that is quite clear. The second on the cross-sectorality is that the urban, by strengthening the cities as a point of entry, and the national, subnational is well prepared, I think is another solution in the future. And having connectivity between cities to cities, it creates a sharing responsibility. And that is important, I think. And the fourth one is, I think, having that fiscal policy that adaptable for the pandemic is becoming crucial and vital. So I think the WHO continue with the process of international forum that we are, bringing together, for instance, foreign policy, finance, and health together to look at different aspects of responsibility to the pandemic.
Thank you.
Yeah,
I think it's very interesting to know. I mean, that would be quite great. Actually, I just received some questions, but I think the time is not allowed to.
If I may to add, Pak Bebep, to the discussion.
Pak Sekjen, please.
Thank you very much. I think I fully agree what's been said by my colleague Irabayashi-san as well as Pak Ludi. And in fact, this is, if I can put that, this vaccination process that we currently have is the early stage of the vaccine, because we don't know the efficiency of the vaccine itself, whether it will be effective for 1 year, for 2 years, or only for 6 months. We don't know. So if it is only effective only for 1 year, then what next? Should we have another vaccination program for the next year, or within the next 2 years? Who's going to fund it? So this is a very crucial issue before us, and that's why I totally agree with what's been said by Pak Ludi. We need to increase our collaboration effort, not only within government, but how we can include all the stakeholders to be on board, how we can mitigate and adapt to these new challenges that we have, huge challenges, because this is very unprecedented and we don't know. Simply, we are learning by doing. So I think this is the key message to all, that by having vaccine right now, it's not necessarily what we are finishing our process. We are still having so many homework that need to be done, not only by the government, I think. Thank you.
Thank you, Pak Cecep. I think that's quite collaborative expressions and explanations, and there are some questions actually. from Dr. Edi Siswanto. It's quite interesting, but it's already been mentioned by Pak Ludi about how, in the context of to revolute socially and economically by incorporation of health protocols, how about the health strategy changes become home-based healthcare? So it's very interesting to know. But I think on the second question that he mentioned about how to change the traditions to be more or changing our cultures from the normal one to the new normal to electronics and so forth. And I think it will be answered by the next session, because the next session will talk about the new cultural adaptation to tackle the pandemic. And there are some questions again as well from the other side, but it's not from the question and answer. I think it can be sent right away after that. But basically, to conclude our sessions today, because our time is only about 2 minutes left, I would like to give you a little bit more how to wrapping up the conclusions about what we have discussed here. I think the point here is about how the multilateral coordination and collaborations, not only by governments, but also as well as with the relevant organizations and all the stakeholders, which relates to the guaranteeing how the access and distributions of the vaccines from those producers countries to the less wealthy countries is quite, elaborate as it is, as mentioned by Pak Ludi and Dr. Hirabayashi. And I think Indonesia has mentioned very well in the context how Ibu Menlu has mentioned that the urgency of international cooperation and collaborations to address the challenges already there. And I think Indonesia is trying to work that out very well, because she's mentioned about 3 critical aspects, and one of which, if I may quote, that to strengthen and reviving the spirit of multilateralism, because health diplomacy completely will recover stronger by togetherness. Now, those events you mentioned about WHO role, and then the UNICEF mentions about how the data has been retrieved from several countries, in particular within this region, shown that particular point. The last point that I would like to mention here, when we are strengthening our international cooperations, and seems to me that the economic recovery would work out on that particular area. Well, I'm not talking about the business, but it's quite clear now who's who becoming what, and who's who becoming how they're producing that. Simply, for examples, how now you mentioned, Dr. Hirabayashi, on your data, several countries completely is becoming a friends of these producers. And then some point when we talked about any region, particularly not the Asia, for example, Latin America, or perhaps the Middle East, or even though in Africa, it completely seeing that there is still a political ways of winning of friends on future relevance, of which, when Pak Cecep saying about the long-term project, is about not now, but for the future, is who will, well, I'm not saying monopolizing, but perhaps when we talked about the competitions on how the vaccines will do, work that out. So that would be one point that the president has mentioned earlier yesterday, that to foster economic recovery, it's not relevant in the context of how the access of the vaccines can be distributed quite equally to all over the countries who are facing now fighting the pandemic. So I think that would be the wrap-up discussions of the 2 great panelists has mentioned to us on those kind of perspective. And I think for that, again, Excellency, Pak Cecep, Mas Ludi, Dr. Hirabayashi, it's my sincere appreciations for being or having a great presentations, as well as a good comprehensive information for both of us and all of us for these participants today. And thank you again for those participants, and my apology for the time management. And then I also would like to apologize for those who are raising the questions, which I cannot fulfill that for these sessions. Again, I would like to extend my sincere appreciations again, as well to the organizers and the committee. Thank you very much. Everybody stay healthy, stay safe. We will pass this pandemic all together. Thank you. Bye-bye.
Thank you very much.
Pak Ludi, terima kasih. Pak Hirabayashi.
Terima kasih.
Terima kasih.
Saya kembalikan kepada teman-teman di MC dan host. Dan Dan terima kasih ada Pak Najib. Pak Najib, terima kasih sudah bisa balik dengan kita. Excellency, thank you. Pak Philip juga terima kasih sudah bisa bergabung dengan kita.
Terima kasih Pak Bebep.
Terima kasih.
Gimana sih, Sam?
Terima kasih. Saya kembalikan kepada teman-teman di host. Kalau nggak nanti saya nyanyi lagi nih. Oh enggak ya?
Global health diplomacy from the expert. The complexity of global health and the needs of collaboration, I think it's very important. From the benefit of vaccine science and also innovation, demand a truly global response. Whether responding to COVID-19 will lead to a more equal partnership for health for all. Thank you and appreciation for Kang Bebet, which has guided our talk in a very attractive way. And thank you also for our speakers for the valuable talk. As our conference title is about health, economic, diplomacy, and social perspective, also important for us to discuss about adaptation to tackle the pandemic. We believe that we need to adopt our behavior to the new cultural adaptation because we don't know when COVID-19 will finish. So the next topic, it is the keynote speech about preparing the people, new cultural adaptation to tackle the pandemic. We would like to invite Mr. Sony Hari B. Harmadi. I would like to read his CV. Sony Hari B. Harmadi, he is act as Ketua Bidang Perubahan Perilaku, Satuan Tugas Penanganan COVID or Chief of Behavior Change, National COVID-19 Task Force. He holds his bachelor degree in economy from University Erlangga and received his doctoral degree from University Indonesia. During his tenures, he holds many important positions, such as Deputy of Coordinating Ministry of Human Development and Cultural Affairs, expert staff of Population of Coordinating Ministry of Human Development and Cultural Affairs, and many others. So, Mr. Sony Hari B. Harmadi, I would like to give the time for you, about 30 minutes. The time is yours, please.
Thank you, Madam. Excellencies, Ambassador of friendly countries, Ambassador from Organization of Islamic Cooperation, Honorable Representatives of Islamic Development Bank, Middle East Committee, academics, health practitioners, public policy practitioners, all participants. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon. Shalom, Om Swastiastu, Namo Buddhaya. Praise and gratitude for the presence of God Almighty, for the blessings, guidance, and grace and blessings of Him we can meet in good health. We thank you very much for inviting us to deliver speech in this very important conference. Ladies and gentlemen, first of all, the head of National Task Force for COVID-19 mitigation, Lieutenant General Doni Monardo, sends his deepest regrets for not being able to make it here today, as he has another urgent event to attend. He sends each and every one of you his warmest regards and wishes you all health in the midst of this global pandemic. Ladies and gentlemen, the COVID-19 pandemic has lasted for almost a year. The first case in Indonesia was identified on March 2nd, 2020. Since then, the government has continuously put in tremendous effort to keep the spread of the virus under control.
In the beginning, the Indonesia's COVID-19 Response Acceleration Task Force was specially created by the President of the Republic of Indonesia to execute programs related to prevention and mitigation of the virus. The main focus lies on strengthening our healthcare system and prepare it for the likely surge in the number of patients by building emergency hospitals, ensuring the supply of PPE to existing hospitals, supplying drugs and ventilators, and many more. As our understanding of the virus evolved, the government replaced the existing task force with the current COVID-19 task force. With a renewed focus on public health resilience, aside from preparing healthcare facilities in handling COVID-19 patients, our strategy expands to increasing awareness in the community and equip them with the necessary knowledge and tools to prevent spread of the virus. Both strategies go hand in hand. Our main goal is to make sure that the healthcare system would not be overwhelmed by the surge and suppress mortality rate. Up to February 23rd, 2020, there have been almost 1.3 million confirmed COVID-19 cases, 158,000 of which are active cases, 1.1 million recoveries, and 35,000 deaths were recorded. Next slide. Learning from experience and other countries' best practices, we realize there is no single intervention capable to tackle the coronavirus pandemic. The Swiss cheese model shows that its intervention has holes. Therefore, a combination of interventions is required. The implementation of 3M health protocols, treaty, test, trace, and treatment and vaccination program are the most used strategies that can be used to control the spread of COVID-19. In addition, individuals, communities, and also governments must move together, take actions and responsibilities. The Behavioral Change Division was established along with the formation of the new COVID-19 task force. Our division is in charge of leading efforts to increase awareness and help the community to ease into the new adaptive behavior situation. In one of our efforts to get a better understanding of public attitude towards the pandemic, we collaborated with Indonesia's Central Bureau of Statistics, which I will refer to forward as BBS, in a survey titled Public Behavior During COVID-19 Pandemic, which was conducted on early to mid-September 2020. And the result of the survey have since been released. In general, the public has a high awareness of the three main prevention efforts against COVID-19: washing hands, wearing masks, and physical distancing. In Indonesia, these actions are commonly referred to as 3M, an abbreviation of the three actions in Indonesian. Despite this high awareness, the main challenge lies in developing this knowledge into consistent behavior. Based on the survey, 17 in 100 people feel that it is unlikely that they will be infected by the virus. Grouped by gender, only 34.8% of male respondents and 33.9% female respondents reveal that they believe that it is possible for them to become infected by COVID-19. Both of these findings indicate that in spite of high public awareness, there seems to be a quite large proportion of the community who believe that it is unlikely for them to become infected by the virus. And we found that 55% of the respondents do not follow health protocols because there are no sanctions associated to violation of the protocols. We also found that 19% of respondents said that they do not see local leaders adhering to the protocol, thus not setting good examples for the public. The words lack of and awareness are the two most used words. Then they explain the reasons for not following health protocols. From the survey, we can conclude that there are still many people who do not comply to health protocols. Prevention efforts thus become very, very important. Our main focus is to disseminate the 3M narrative, wear masks, keep your distance, and avoid crowds, and wash your hands. Behavioral change is crucial in ending the pandemic. The implementation of behavioral change is required to prevent and stop the spread of COVID-19. And this requires discipline in implementing health protocols. How about the challenge? Our biggest challenge, something that we have been aware of from the start, of course, is that behavior change takes time, especially in a large country like Indonesia, comprising of thousands of islands with people from assorted backgrounds, religions, cultures, and languages. Our strategies have to be tailor-made to suit the local norms and cultures. The main problem that we attempt to address is those who do not follow existing health protocols or only partially abide by them. We believe that there has to be separate strategies aimed to address those who only partially abide to health protocols and those who do not follow them at all. Inducing behavior change requires both internal and external motivation of the subject. An internal motivation rises from acknowledging one's needs, interests, values, benefits, beliefs, and then finally persuading other people. External motivations are driven by incentives, punishment, advices, and encouragement. We are indeed aware that we cannot ignite behavior change overnight accordingly. It is a lengthy process which requires the subject, in this case, our people, to become aware of the issue, gaining necessary information and knowledge, form an attitude towards their received information and perceived threats, and only then will their behaviors change. There are 5 targets of the behavior change program: individual, family, institution, community, and region. The behavior change program consists of 3 activities. Education subdivision intervention. This targets educational institutions by preparing public education materials. Second one is socialization subdivision intervention. For the public, emphasize for family, mothers, and teenagers. Mitigation subdivision intervention for the public in areas with low level of compliance. We have the tagline of remember mother's words, or ingat pesan ibu, which we communicate in all our agendas. We try to motivate people to comply to health protocols by introducing this following: incentive, or the carrot, through giving incentives which acts as a reward for those who abide by the rules. Second one is punishment, or the whip, introducing sanctions to those who do not follow the rules so that the people avoid violating the rules out of not wanting to receive punishment. Third one is advice, or the sermon, initiating massive campaigns. This is done to inform the public what behavior is expected of them. encouragement or the nudge to make sure the expected behavior is something the public could easily perform. Behavior change success will depend on two things: effectivity and efficiency. Effectivity is measured on whether the efforts result in behavior change. Efficiency is measured by choosing intervention that requires minimum cost and generate maximum output. Other than that, external support is very much needed in order for the program to do well. Political support, organizational support, and individual and service provider support. Its aspect is needed, so that behavior change can be formed. The behavior change we expect from the public consists of three things. 3M narration: to wear a mask, keeping distance and avoid crowds, and to wash hands with soap. 3T narration: to test people who shows COVID-19 symptoms, trace their contacts, and make sure they get the treatment needed when tested positive. Vaccination: to encourage people to get their vaccines when it's time and educate the public about vaccine. And then we create behavior change materials in the form of guidelines, videos, flyers, social media contents, songs, and data analysis. We socialize and educate through various communication platforms. We encourage the movement of Duta Perubahan Perilaku. In English, we call it behavior change ambassador, to make them educate people. Pentahelix collaboration to strengthen behavior change socialization by working with various institutions such as religious leaders, community leaders, public figures, academics from various fields of education, and many more. They socialize the campaign message through media or religious community or community occasions. In making behavior change happen, we use cultural approach by translating the behavior change guideline in local Indonesian languages. So far, we have translated the guideline to 100 local languages. Previously, we have done with 77 local languages, and now we have 100 local languages. By translating the book to local languages, it will be easier for the locals to understand the materials we provide. We are working together with numerous public figures, from religious clerks, cultural figures, to artists and musicians, to disseminate our message and endorse adoption of health protocols. One of our most notable efforts include the Ingat Pesan Ibu jingle, created and sang by Padi Ribon, one of our top local musicians. This jingle is played continuously in assorted media channels. We were also helped by a group creative of young people. They made board games called Palagan for families so that parents can play while teaching their children about COVID-19. To reach all levels of society, we have Duta Perubahan Perilaku or behavior change ambassadors all around Indonesia. They act as role models for the public regarding health protocols. They also educate and socialize the public about COVID-19 and 3M, and they must report their activities on our application. Until 21st February, we have almost 80,000 ambassadors who come from a variety of background and professions. We are also concerned about how the pandemic affects people with disabilities and vulnerable groups, and we currently have ambassadors assigned to reach out to these groups. This is number of people who have been educated, and number of reports submitted by Duta Perubahan Perilaku. One of the most important keys in handling COVID-19 is the role and participation of the communities. Currently, we are using a community-based strategy through the formation of village or sub-district command posts. We call it Posko Desa. Therefore, a village or sub-district command post was established that aims as a center for planning, coordinating, and controlling COVID-19 in each area. The goal is that implementation and supervision at the lowest level of the community can be done effectively. The village or sub-district command post plays 4 roles. First one is prevention, 3M socialization implementation, mobility restriction. The second one is treatment, health treatment, treaty, quarantine, vaccination. The third one is coaching and force discipline. The fourth one is sport, record and report, logistic administration, data and communication. For the closing remarks, know the self, know the enemy, 1,000 battles, 1,000 victories. May God always give his grace and guidance to all of us in creating a great life for us all. Thank you very much. Very good afternoon and wassalamualaikum warahmatullahi wabarakatuh. I have finished my presentation.
Distinguished ladies and gentlemen, after very interesting discussion about global health and vaccine diplomacy, now we come to the last session of the second day's conference, that no less interesting, with the topic New Cultural Adaptations. Thanks, we have Mr. Lin Newman as moderator. Good afternoon, Mr. Lin. Mr. Lin Newman, Managing Director, American Chamber Indonesia. He was born and raised in Phoenix, Arizona. Most recently, he was the founding editor of the Jakarta Globe from 2008 to 2012. He also have a live TV talk show on Berita Satu TV from 2012 to 2013. Since October 2014, Lin has served as the Managing Director of AmCham Indonesia in Jakarta. Mr. Lim, screen and time is yours.
Hi. Can you hear me now? Sorry, I think I was muted, but I'm not muted anymore. Can you hear me?
Yes, yes,
okay.
We can.
Okay, good, because I can't hear anybody, so I hope you can hear me. Thank you very much. I'm Lin Newman. I'm the Managing Director of AmCham Indonesia. We've been very active from an investor's point of view in what's happening with the pandemic, and we have a lot of interactions with the Satgas COVID and Ministry of Health and others on these issues. And I see a number of friends are here today, and I'm delighted that I was invited to be a moderator. And I look forward to hearing our panelists. I do have a brief announcement. I think that our good friend Ambassador Ridwan Kamil will be a bit late, so we're going to hopefully he'll make it. He has an appointment, I think, with the president. So we hope that this will all work out. So we're going to reverse order a little bit the panel, and I'm going to start by introducing Fajar Ibnu Tufail, who is a researcher with the Indonesian Institute of Science. Fajar has a PhD in anthropology from the University of Wisconsin at Madison and a master's degree from Rutgers in New Jersey. And look forward to hearing what he has to say about this subject of how cultural changes are taking place as a result of COVID-19. I'm also now going to take the opportunity to introduce our second speaker, who is Dr. Lucine Razawi. And I have probably butchered your name. I apologize. How do I pronounce your name correctly?
Lucine Razawi, it's fine.
Okay, Lucine Razawi, not too bad. Dr. Razawi is currently the Director of Cultural Affairs at the OIC since September 2020. Before that, he was a career diplomat with the Ministry of Foreign Affairs in the Kingdom of Morocco, and he has served in numerous posts abroad, including in Korea and elsewhere. And he holds a PhD in political science from Hankook University of Foreign Studies in Seoul, a university I remember well from my time in Seoul. I used to work in Seoul, one of my favorite cities, was there before I came to Jakarta. Now let's turn, without further ado, we'll turn to Pak Fajar to kick off the discussion. Pak Fajar, the floor is yours. Terima kasih.
Yes, thank you, Lynn, for the introductions. And good afternoon, ladies and gentlemen. And it's really my pleasure to be able to join this interesting seminar today. And I'd like to thank you, the organizing committee, for inviting me, and also to CSIS, and also to Ikatan Alumni Unpad for inviting me to give these presentations. So I think I'm not going to talk a lot about the data, because I think as far as I know that there has been a lot of studies conducted in terms of the social and cultural effect or relationship of the COVID prevention and also the pandemics. So I'm just kind of going to talk a little bit about the framework, and as you know, because I was invited to talk a little bit about the way how we as anthropologists or sociologists understand these situations, and to what extent that our understanding, our conceptual understanding, can help somehow in trying to not only to cope with this pandemic, but also to understand how the social and cultural changes has been taking place since the pandemic started. So I'm kind of will go moving forward and back and forward from concepts and approaches, and also to the some data. But I'm not, as I said, I'm not going into detail with discussing the data, but some kind of trying to understand how we put the data in the more kind of a social and cultural context of explanation. So let me begin with this first slide. And thank you for the organizing committee for helping me with these share screen presentations. So at least from my point of view, there are at least three dimensions getting involved in when we talk about COVID. So the first one is the epidemiological dimension. So in that dimension, we are talking about the contagions and also the way how the virus move from one person to another person. So the kind of issues, public health issues, and we in this dimension we actually listen or hearing a lot from the epidemiologists, public health experts, and so forth. So, and the second one is the governmental dimension, and which dealing with the regulations and rules and law enforcement and so forth. And in this dimension, then we are mostly dealing with the way how policy works, the way how bureaucrats construct their kind of policy oriented uh, 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 practices. But there are another there is another dimension that I think, unfortunately, in the context of Indonesia, this is something that has been quite overlooked, which is the socio-cultural dimensions, and meaning that we're talking about dimension. We are this socio-cultural dimension. We are talking about behavior. We are talking about values. We are talking about norms and so forth. And I think this is one of the things that we, the anthropologists, sociologists, or other social scientists can contribute in order to understand what is actually going on in terms of the COVID pandemic uh, and its social and cultural implications. Next slide, please. So before I'm going into these kind of more detailed discussions of how we understand these context in Indonesia, I like to briefly talk a little bit, talk about this, the way how we anthropologists or probably social scientists understand this phenomenon. And as we see that from this point of view, from our point of view, that we are talking now, we are dealing with some kind of what we call the engagement with risk. So this is the most important part of the socio-cultural dimension, is that the way how we engage with the risk. And from a lot of studies on disaster management, and also from socio-cultural perspective, that we actually uh, briefly understand risk as consisting of two dimensions, or two forms. The one is the tangible risk. As you, for example, if you look at the volcanic eruption, then you can see that the tangible, the risk is there. You can see it. And but the other one is we are dealing with this current risk that we are talking about right now, is this the so-called intangible dimension risk. Well, it's kind of a little bit controversial talking intangible, because it's actually this risk can be felt. You know, if you fell sick from the COVID, then this is becoming a kind of a tangible experience also, because you can see actually, and you can feel actually the risk in your body. So, but one thing that connects the two kind of risk perception is the risk, the forms, is that we understand risk more as a kind of a perception that shaped by socio-cultural context. So there is no direct causal connection between the form, the kinds of hazard that we face, whether it's tangible or it is intangible. But both we have to understand, we have to perceive that kind of a risk by way of mediated by socio-cultural context. So this is one thing that I like to highlight in my presentation, that when we're talking about the pandemic as a kind of a risk, then at the same time, we're not only talking about ourselves, but at the same time, we are also talking about the context or socio-cultural context in which the risk is being mediated through our perception. Next, please. So just kind of briefly in reiterating what I earlier said, that there are two ways of understanding this kind of effect, influence of from the risk to our individual context. It's direct influence to perception. And this is what usually people talking in general, that there is some kind of there is a understanding that the risk directly influence our perception. But that is something that most of anthropologists and sociologists are becoming very critical of, because we understand that there is mediating factors. There is a society, there is a norms, there's a culture that mediates that kind of influence. So we are not only understanding the risks or the pandemic or the COVID directly, but the way how we understand is mediated by the way how we live in society in our daily life. Next slide, please. So this is brings me to the most important part in my presentations, and I like to emphasize this later on in my discussion of some few data, that people often think that regulation and law enforcement can solve the problem. So when you have the regulation and law enforcement, it's good, and then there is a continuous and consistent law enforcement, and then the problem is solved. Well, I think that it's not always the case, and even though important, law enforcement is not the only factor that shape behavior. So I would like to really underline this point, because it seems that a lot of policy in Indonesia and also in elsewhere relies on this law enforcement and regulation to solve the problem and to make people comply with this with the directive, the governmental directive. But that, as you can see in a lot of context, that this is not always the case, and we have to look for another factors that can also contribute to understand how people shape their behavior in terms of in dealing or engaging with the COVID pandemic as a risk. Next, please. So just brief again in repeating what I said earlier, but now I try to understand that kind of contextual factors. There are a lot of different contextual factors that we can have to pay attention to. There is a group pressure, regulation, religious belief, social norm, feeling, direct experience, and social structure, and so forth, and what have you. And but this actually operating in combination. So there are always combination of multiple factors that influence a decision. So this kind of a combination is one thing that we have to understand in order to try to understand why people, for example, decide or comply to wear mask, or sometimes they also comply or choose to undergo vaccination. So this kind of combination of multiple factors is very important for anthropologists, sociologists to understand, because as different society has different combination of contextual factors, and I think that is a very bottom line of the way how we understand, or we anthropologists, sociologists understand, choose. Next, please. So in order to next slide, please. So in order to illustrate the point that I raised in my presentation, I like to borrow the data. Please go back to to previous slide, please. So the slide before this one. Maaf. Halo. I'm sorry. I think I lost the connection, right? Can you hear me?
Yes, Pak.
We can hear you, but I don't know, the staff needs to back up 2
Hello?
slides, yeah?
Yeah, back up 2 slide, please. But you can hear me, Lynn, right?
Yeah, there it is.
Yeah. Okay, well, yeah, that's the slide. Okay.
Yeah.
Okay, thank you. So in order to illustrate the point that I make, I'll use I'll borrow the recent survey conducted by CSIS to discuss in a little bit more detail on the point that I raised earlier. So it is interesting that the CSIS did the survey in 2 different contexts of society. The one is Jakarta and Jogja, and from my anthropological point of view, and it speaks of interesting point. The first one that we are talking about Jakarta and compared to Jogja, there is a kind of different societal norms that are taking place. The one is the rational attachment to some kind of a bureaucratic structures, and the other one is more kind of a cultural attachment to leadership, like we have a sultan in Jogja and so forth. And also this network quite different from Jakarta and the Jogja, the social network, in which in Jogja you have an expanded social network from family, workplace, and community. There are working together, and there has been a lot of anthropological research done in this kind of topics. And in Jakarta, you have a very limited situated social network, only limited to family and workplace. So even though there are some, variations in the context of, if we look at the daily life, but put it in a theoretical conceptual perspective, there are 2 at least different societal characteristics, and also the access to the media, and from in Jakarta, people have an access to media more as an individual access to media. But in the Jogja, you have not only individual access to media, but also community mediated access to media. And that, I think this is a very important part of the way how try to frame their perceptions about what kind of risks that they are now facing. Next slide, please. So I like to discuss in more detail several findings of the CSIS survey that was announced a few days ago. That to answer the few concerns that we have. The first one: why don't people follow the health protocols? And it is very interesting to if you look at there is, if you combine the figures, the statistic from Jakarta and Jogja, then you have a very high figure, high number, high percentage that point out to the feeling of people, how people feel about the pandemic. They feel tired, they feel they also feel bored with the situation. But at the same time, this kind of a feeling combined with this lack of knowledge of the pandemic, and I think it's very poignant data that the CSIS has presented, that individual feeling and not social or public concern save the behavior. So why don't people follow the health protocol? Because they just feel tired or bored. They just feel tired or bored. And this is not only, they're not talking about social or public concern, but more a kind of individual feeling. It's kind of a more bodily related feeling of tired and boring. So that kind of interesting facts that we can interpret, and then I think that this kind of egoistic context combined with the lack of knowledge, it becomes a very deadly factors and very important factors to consider. So what is really also interesting in this figures that the structural factors, regulation, law enforcement play a little influence in shaping behavior. So this is really, for me, it's very eye-opening because it's in contrast to another countries like like Japan or Taiwan or Vietnam, for example. But in Indonesia, these structural factors, regulation or law enforcement, just play a little influence, and then I think in shaping behavior. And I think this is a very not only interesting but also alarming finding. So the implication of this facts is that I will kind of suggest that intervention should be done on the level of individual norms and values. So dealing more on the factors that influence how individuals shape their norm or values. So this is, I think, in the context of Indonesia and in compared to another country. So structural factors probably play a little less little important factors to drive the people behavior. So this kind of a finding is really, for me, it's eye-opening, because as a social scientist, we always think that when we have a regulation, when we have a law enforcement in place, then people will follow what the government told you or what the community leaders told, but that's not always the case. So yeah, the next slide. So but this is really important also finding from CSIS that they pay very specific attention on the Yogyakarta context, and I try to understand it as a way of highlighting the cultural factors. So it says that the role of the Kraton, the role of the Sultan, actually has been quite effective for influencing the way how people deal with the pandemic. So in anthropological sense, in a sociological sense, we can also kind of conclude or maybe interpret it as the way how cultural authority works in a society where cultural norms or cultural symbolism is always embedded in political power. Like for example, as you say that as you already know that the Sultan as governor, not only as a symbolic leader, but is also a political leader in Jogja. So when these two factors combine, and the Sultan is able to exert their symbolic resources and channel it into the more rational political project or political program, then it works quite effectively. So, but the question is then, what about in a context of situation where political leadership is separated from cultural norm? And this is the majority of the context in Indonesia. So not always, Yogyakarta is a very special case. But so that's why I suggest that we have to look at, we have to pay more attention to find, or even if necessarily invent the cultural authority. So this is what we, I think, one way of the thing to try to bring this kind of cultural symbolisms and cultural authority in line with this political program or governmental regulation and so forth. Next slide, please. So the other slide that I would like to finding that I like to highlight from the CSIS finding, CSIS result is this why the how people perceive the COVID. So it kind of alarming for me. It's also surprising to me to see that at least from CSIS survey, it says that 2 and 10 people, 2 out of 10 people in Yogyakarta and Jakarta don't believe in COVID. But what is really important to underline also that those are mostly young people aged from 17 to 22 years old. And the same kind of statistical figure can be also found in the question of how people perceive the effectiveness of vaccines. And 6 in 10 people do not believe in the effectiveness of vaccine. And again, this figure comes from very younger people, from 17 to 22 years old. So how do we learn from this statistic? How do we do some interpretation, sociological and anthropological interpretation of these facts? So for me, I think that differences in risk perceptions according to age are really, really important to pay attention to. And you can see that the younger people are less bounded by social norms. But the question of whether they are bounded by the cultural or religious norm is something that is the statistic or the survey does not really provide the data. But in terms of social norms, that it's clear that younger people feel they are not really bounded by the norm. They don't really, sorry, please go back to the, okay. Why, then the question is, why do young people perceive in this way? That for me, I think that one of the factors is that to underline is the individual context of these perceptions, and young people think they are less vulnerable, so that's why they are more willing to take higher risks. And I think this is this fact, it's almost common in many societies, that younger people are willing to take higher risks. But if you look at as an individual in individual context, this kind of fact, it's acceptable, quote unquote. But if you put this context in a pandemic situation, so it becomes a very alarming, very worrying fact that the young people, young generation, are actually the one who are driving the pandemic to become worse. Next, please. So again, and then I like to give some kind of a summary on when we compare the anthropological social patterns of COVID prevention and vaccine acceptance in the context of Jakarta and Jogja. Again, I draw this conclusion, or draw this summary from CSIS survey, that there are 3 important findings. There are 3 important elements that we have to pay attention to. First one is that the individual effect instead of the public norms is a more important factors in shaping behavior, whether that is behavior of complying with the prevention efforts, or also the behavior to take the vaccination. But I think individual effect, so instead of public norms, is more important factor. And this is a very contrary to the more kind of common understanding that we have, that public norms, cultural norm is more important. But actually, this finding highlights another side dimension, that individual effect is actually more important. And the other one is the second one is the structural factors, the regulation and enforcement, fines, and etc. play less significant role to shape the risky behavior. So yes, probably people will be deterred if they have to pay a higher fine, but that doesn't really determine. It doesn't really lead to behavioral change. There are 2 different kinds of social factors. Determine you will not do that kind of thing, but that doesn't really preclude you for doing the thing. So if there is a police, if there is a Trump tip there, then you will, you are not doing the thing. But when everybody is gone, the lay enforcement is gone, then you will still doing the thing. That's so deferment and also behavioral change is something conceptually different. And the third one, in a specific context, cultural authority can be a very determining factors. But again, as I said earlier, that what about in a context other than Jogja? So this is something that we have to also pay attention to. Next slide, please. So then the question is that how do we intervene anthropologically? If you want to talk, we want to take anthropological factors into consideration when we try to intervene and change the behavior, or at least shape the public behavior. So there are four aspects. The first one is the target. So it is we have to be more specific and be more pay more attention to the young generations. So you can remember what happened in Italy, in America, in Japan, for example. There are so many less considerate younger people that they didn't really care that they can be someone who can spread the viruses. But young generation is something that we have to pay more attention to, and also in Indonesia. And the second one, and this is very important, what I call the one policy fits for all is not enough. So the diversity of local cultural social authority should be paid more attention. So the comparison between Jakarta and Jogja in JSS survey is very good example in the way how diversity of local cultural social authority can be major factors to shape people's behavior. And I think in the context of Indonesia, where we have a different lot of social cultural context, then has to be diversity of variety also in the way how policy is formulated. And the third one, the structural approach only is less effective. So intervention to social groups who play a significant role has to be done, and then and social structural approach is probably kind of it's important, but it doesn't really interfere directly to the production of risk image. So I think the way how this intervention has to be done also within the community, within the social group who produce the risk image. So this is like celebrities, like religious leader and so forth, who are very central in the production of public image. So this is intervention. It's more, I think, it's more effective than the kind of a structural approach. And the last one, which I think very also important and a little bit abstract point that I like to propose is that transforming individual concern into public norms. So as I mentioned earlier, that in Indonesia context, it's quite surprising to see that individual affect is more important than public norm. And how do we raise awareness that if society, for example, like collapses, it will also affect individual well-being. So individual well-being, it's the basic of decision making, public decision making, mostly in Indonesia, at least in the context of the survey. That how do we raise awareness among the younger people, in particular, that this is when the society collapse, when the COVID spread all over the places, then it will affect your individual well-being also. So this is a kind of issues that we have to raise as a kind of a target for awareness raising project. So The last point that I like to make is that the COVID pandemic actually teaches us that the Indonesian society is not a communal society like what most anthropologists believe. And I think I'll draw more. I will draw more more criticism here. And then we tend to believe that Indonesian society is a communal society, where people behave as a part of the communal group. So this pandemic actually opened up a different side, another side of the Indonesian society, which is not really a communal society. So communal standards only apply in very restricted context. For example, like within the family, whether it's a core family or extended family, also in small neighborhood and places places like that. So public norms where you feel you do not know other people, does do not really works in Indonesia. So these communal standards is only having a very limited factors in influencing or shaping individual behavior. So next slide. I think that is my last slide. Yes. Thank you. Back to the moderator, and please stay safe and stay healthy, people.
Thank you very much, Dr. Fadra. That's a really interesting presentation, and I take it to heart because as an American, I've spent the better part of I live in Indonesia, but I've spent the better part of the last year deeply embarrassed by the behavior of especially American young people. And I find myself wondering, why can't they listen? Why can't they pay more attention to the lessons that we get from societies that perhaps are more disciplined? But it's a really interesting discussion on the aspects of coping with COVID in Indonesia. Thank you very much. I really enjoyed that. If you have questions, please line them up for us in the Q&A box, and we'll get to them after the presentation of Mr. Rizawi. Mr. Rizawi, it's your turn. Tell us what it looks like from Morocco.
Well, thank you so much for, first of all, for being with you here today. Basically, I would like to start by setting the tone from the very beginning. I'm representing the Organization of Islamic Cooperation, which is the second largest organization after the UN. It enlists among its member states 57 countries, along with other countries with observer status. So we are talking here about a wide network of partners and of member states. So my approach, or the approach of the organization to this conference, will be a little bit different. So I'll target the issue from a broader perspective rather than a local or a national perspective. First of all, allow me to express my gratitude on behalf of His Excellency, the Secretary General of the Organization of Islamic Cooperation, to the organizers for being invited to this international conference. My deepest thanks go also to the authorities in Indonesia for their constant support of the OIC and for their fruitful contributions to the global efforts aiming at serving the noble causes of humanity at large. This conference comes at a perfect timing for different reasons. First, the world has been undergoing the negative impacts of this pandemic without a clear idea about when it could be over, with the development of new variants in different parts of the globe and the continuing debate on the effectiveness of the vaccines developed by various stakeholders. Second, the pandemic has brought fundamental impacts to almost every single aspect of our life, including the way we manage our daily work, to our social interaction, our school system, our security approaches, and our economic models, our manners of connecting to the world and traveling around. Third, the pandemic has been a threat to all nations without exception, regardless of their international status in terms of military or economic prowess, race, culture, or religion. Thus, it has become a global problem for all humankind. As was rightly put by the WHO, no one is safe until everyone is safe, and most of our interventions today have focused on this. It is clear also that besides the devastating health impacts of COVID-19, the human loss and the collapse of states' capacity to provide beds and adequate health treatments to affected people, the pandemic has literally led to a major global economic catastrophe, which the International Monetary Fund qualifies as the worst in our living memory. So with the fast rising unemployment, which has left millions of people with no income and increased the fragility and vulnerability of huge categories of our social fabrics, governments were obliged to borrow heavily to subsidize their troubled economies and cater for the needs of those who were left with no jobs or income. The aftermath of the pandemic on social relations were even bigger, and this is basically our topic today, how countries have adapted culturally and socially to the impacts of the pandemic. So the aftermath of the pandemic, as I said, on these social and cultural relations were even bigger, as it has exposed not only the vulnerability and inequality in societies, but has also brought new forms of discrimination, leading to huge divisions within societies. According to one of the reports on social vulnerability caused by COVID-19, the most impacted people tend to be marginalized and excluded, depend heavily on the informal economy for survival, occupy areas prone to shocks, have inadequate access to social services, lack social protection, are denied access to services on the basis of age, gender, race, ethnicity, religion, migrant, or refugee status, etc. COVID also has boasted xenophobia, hate-mongering, scapegoating, discrimination, and racism. It is very unfortunate that right-wing groups have used this pandemic to pursue their wicked agenda of anti-migrants, white supremacists, ultra-nationalists, anti-Semitic, and Islamophobia. Many countries have witnessed a spike in anti-immigrants, including anti-Muslim sentiments. Those with precarious citizenship status, such as migrant workers, refugees, and international students, have experienced additional level of discrimination during the pandemic. There is no doubt that COVID-19 has come with a lot of challenges to mainstream cultural and social norms, bearing in mind that any novel challenge that does not exist in the memories of anyone alive or in the protocols, rules, and taboos of our institutions could disturb long-established systems. Societies are normally resistant to change, especially when this change concerns their own freedoms, habits, and livelihoods. In the face of these challenges, and as a way to adapt to the new social and cultural trends posed by the pandemic, the OIC approach has been proactive throughout, calling for the necessity to promote unity and solidarity among member states in the face of these unprecedented challenges. Some of these steps that were taken will be listed here in order to give you an idea on how the organization dealt with this pandemic. I will start with the extraordinary video conference meeting of the OIC Executive Committee at the level of foreign ministers held in April 22nd, 2020, which reiterated the need for a transparent, robust, coordinated, large-scale, and scientifically oriented global response to contain the pandemic. The meeting noted that managing the crisis and mitigating its impact requires an emphasis on retaining jobs, supporting the most vulnerable ones, including the self-employed, ensuring liquidity, promoting skill development, introducing favorable tax policies, lifting travel restriction as soon as the health emergency allows, boosting market and consumer confidence to recover economic growth and sustain financial stability. In this respect, the Islamic Development Bank, which is a specialized agency within the OIC family, launched a $2.2 billion strategic preparedness and response program to counter the coronavirus disease through supporting the efforts to prevent, contain, mitigate, and recover from its impact. The Islamic Solidarity Fund, which is another organ of the OIC, made a significant donation to the contingency account created to assist member states, especially the least developed countries, to strengthen their capabilities, particularly in the health sector, to face the shortage of essential medical supplies, especially testing kits and personal protective equipment for health workers in the member states. The International Fiqh Academy, another organ yet of the organization, organized virtually the second Fiqh Medical Symposium to clarify to some extent the religious and jurisprudential aspects of how to deal with the pandemic and to review the various fiqh aspects to deal with this pandemic. This symposium actually acknowledged the important role of religious and community leaders, Islamic scholars, and prominent figures in raising public awareness about personal hygiene, safe practices, and appropriate social behaviors as important tools to curb the spread of the disease, including the closure of mosques and places of worship. Some of the major lessons to retain from these symposiums, which stand basically as cultural adaptations to the pandemics, are the following. Islamic jurisprudence presents important maxims to use in times of crisis, the most important of which are that when it comes to saving lives, exemptions take precedence over duties. Rulers' decisions must be in favor of public interest, and rulers may restrict permissible things within specific areas to protect the larger public. It is also permissible within this pandemic and as a way to adapt again to these cultural and social restraints imposed by COVID-19, it is permissible for states and governments to impose restrictions on individual freedoms and liberties, whether by preventing entry into and exit from cities, imposing a partial or complete lockdown, imposing a travel ban, banning financial operations using notes and coins, suspending businesses, services, schools, and closing markets. It is also necessary to respect decisions made by states and governments concerning social distancing, which helps the encirclement of the virus. Among the other precautions taken to adapt culturally to the pandemic is the closing of mosques for Friday prayer. And this was a very hot issue debated throughout the Muslim world. It was also necessary to close daily congregational prayers, Taraweeh prayers and Eid prayers, the suspension of Hajj and Umrah, businesses, and various means of transportation, the imposition of curfews, the closing of schools and universities, the adoption of distance learning, which is also a debatable issue, and the cancellation of all other forms of gatherings. It was also permissible to expedite the payment of zakat to help those who are in need and those who have lost their livelihood due to the pandemic. Muslims and the media were also encouraged to avoid spreading dreadful rumors among people, and everyone was basically incited to fight against false and unreliable information to avoid incurring negative consequences. People should also spread hope and optimism, and this is basically some parts of the work that has been done by the OIC throughout the 57 countries that are represented and are member states. So people basically, we advise them, and the Islamic Fiqh Academy did a great work in providing brochures and all kinds of advices to push people to spread hope and optimism in the hearts of others, and to promote lectures and documentaries on strengthening immunity under the supervision of the official authorities of every country. Countries and charities that have excess medical equipment, whether by virtue of manufacturing or otherwise, were also encouraged to donate the medical equipment and devices to other countries and communities in need to confront this pandemic, and this all within a spirit of solidarity and unity. Doctors and competent scientists were also encouraged to carry out research and scientific experiments in accordance with internationally accredited methodologies, research requirements, and Sharia compliant rules for biomedical research. Appropriate economic plans were established also to secure all necessary goods. People are not allowed to store necessary goods above their own needs, as this raises prices and leads to extravagance, which is prohibited in Islam. And we have seen a lot of the scenes throughout the world of people trying to buy as maximum of goods as possible, while this is a very negative attitude, socially and culturally speaking, because it basically puts other people in a difficult situation, those who have not the means to amass all these consumer goods and store them in their homes. One other aspect which is most important also is the marriage during this COVID pandemic. So marriage contracts may occur through various means of communication, as long as it includes the necessary pillars and conditions, such as the knowledge of the relevant authorities, the presence of both parties, and the presence of witnesses. The wedding ceremony must consist of the minimum possible number of close relatives, and medical provisions and directives should be respected. The Council of the Fiqh Academy had obviously prohibited online marriage contract. So these are basically some steps that were advised by the International Fiqh Academy to advise people on how to act socially and culturally, and how to adapt their attitudes to the new circumstances imposed by the pandemic. From another perspective, the OIC has also launched a far-reaching media awareness campaign under the hashtag OIC Countries Combat COVID-19 in Arabic, English, and French, and on OIC social media platform, where hundreds of videos, graphics, photos, and other informative material have been published. A special page on the official website of the organization was created and has been updated every half hour with information and statistics on the spread of the novel coronavirus in the OIC member states. Besides these efforts to accommodate the cultural and social changes imposed by the pandemic, the OIC has been active in lending support to the UN Global Humanitarian Response Plan for migrants, refugees, displaced persons, and host communities, as well as the UN Response and Recovery Fund for the least developed and low and middle income countries. Some examples of this is the way the OIC treated with the Rohingya, for example, crisis in Myanmar and Bangladesh, and how our role was very constructive in helping these displaced people get the basic necessary needs to deal with the COVID and to deal with their own trauma of being displaced from their own countries. Another example is also our work with the least developed countries, and how we have fought basically and worked with our partners to basically remove the debt on these countries to allow them to have more resources to adapt to culturally, socially, and economically to the crisis. In this respect, the organization made urgent appeals to the international financial institutions and the bilateral, regional, and international partners, especially the World Bank and the International Monetary Fund, to intensify their efforts in easing debt burden on LDCs, less developed countries, and provide all the possible options, including financial assistance, rescheduling of the payment of current debts, concessional loans, and basic support accessible to IC member states to combat the COVID-19 consequences. It is true, though, that the pandemic has put all paradigms to the test, as it has exposed the inadequacies of our health and work systems. It did not only took lives, but also businesses, jobs, and entire ecosystems, leading to inequality, poverty, social exclusion, and unfair and unequal conditions between countries and within countries. Therefore, the OIC believes that the priority today is to facilitate the transition towards more resilient and sustainable economies and health systems, reinforce structures liable to institute social justice and social inclusion, and promote the role of digital technology worldwide, as it has proved to be the only means that has kept our societies active and functional, providing education, health, communication, and other essential services threatened by the pandemic. So reducing the huge gap in access to digital technology and securing an all-inclusive global process of digital transformation is the challenge to overcome in the years to come. As a way to conclude, let me say that as the world is still fighting the social and economic fallout from the COVID-19, we need more visionary, innovative actions, more solidarity among and within nations, and more multilateral cooperation to work out collective solutions to common global problems, notably the issue of providing vaccines to all members of the international family in a spirit of unity and mutual assistance. And of course, in the Q&A sessions, I'll be happy to answer any questions in this regard. Thank you so much for your attention. Thank you.
Thank you so much. Very, very interesting presentation, and glad to hear of all the work that's been going on with the OIC. We have some questions for our panel. I think that it looks like the discussion of some of the sociological factors and anthropological factors at work has caught people's attention. I do have to make one announcement. Unfortunately, Governor Ridwan Kamil will not be joining us today. He is caught in a meeting at the palace and has to attend to that, and won't be able to come into the meeting today. It's a shame, but I'm sure we'll get other opportunities to talk with him. I'm going to. I think this first question is really kind of directed at Dr. Fajar's presentation. One of our attendees is asking, can reward appreciation theory be applied to increase compliance with health protocols? Some say that rewards for people who follow protocols would be more effective rather than punishing those who don't follow protocols. Our questioner is asking for some enlightenment on this social issue, which is very much being discussed also in social media. Dr. Fajar?
Yes, thank you, Lynn. Yes, I'd like to answer the first questions on the reward and punishment. And I think, well, this is at least some scholars or some experts has different answers to the questions. But if you like to ask my answers, then I think in my presentation I'm kind of leaning toward the more cultural and sociological answer instead of this kind of a more kind of behavioral answer. And then when your question is actually is that the reward and punishment is enough, it can be effective to shape the behavior? Well, my short answer will be I will be no. That yes, it becomes very important and not becoming very. It can also be influential, but that is not the only option that we have. As I explained earlier, that if you this is kind of a understanding the differences between deterrence and behavior change. And if you have punishment and reward, is actually you assume that there is some kind of benefits that you will get from complying to the regulation. But that is only happening when you have a direct relationship with someone who hold the right to punish and you to provide rewards, for example, the police and local government and so forth. But once you these elements, there is no police, there is no monitoring and so forth, and then you will not change your behavior. So this is, I think, that's why the punishment and reward is somehow for me it's less effective than trying to understand to take the issue as a social, more kind of a social uh, uh, intervention. So that's my short question. So uh, probably will be different from other, some people who are from other, tradition will disciplinary tradition will say, well, yeah, it's very important. If you want to have people to comply, then you have to invent a good system of reward and punishment. Yeah, that should be fine. But from sociological and anthropological point of view, I think it's not enough to say the least. Thank you, Lynn.
Thank you, Dr. Fajar. I have another question here that is really quite interesting from one of our attendees. And this is looking for a sociological, anthropological explanation for the various responses of people in society toward the vaccination program. According to the vaccine acceptance survey, there isn't much of an increment on the number of people who wish to be vaccinated even after witnessing the president get vaccinated. How can we help to increase people's awareness and acceptance of the vaccine? And either of you can jump in and answer this. I think there may be some interesting viewpoints from elsewhere in the Islamic world, and as well as the experience here in Indonesia.
If you allow me, I mean, effectively, that's one of the issues we have mentioned here in the presentation. The OIC has been working hard to promote, I mean, the better attitudes and good conduct when it terms either to dealing with the pandemic or also dealing with the vaccination issue, because there are a lot of fake news in social media, a lot of policies that are widespread by those people who are with the conspiracy, who promotes conspiracy theories and who are working for different agendas. And they are very present on social media, and they try to propagate and spread this false information about the vaccines. And it's normal because, as I said in my presentation, societies are very resistant when it comes to changes, when it comes to curbing on their own freedoms and their habits and livelihoods. So you cannot convince somebody who has lost his job and has no income to care for his family and not to go out and to keep his social distance, because this is how he makes a living, this is how he brings bread to the table for his family. So the idea of being suspicious of the vaccines is a result mainly of this negative impact of social media and fake news, as I said, propagated by some particular people who are promoting negative agendas. We have seen throughout the world, I mean, campaigns on social media, and we have seen also protests in the streets in different westernized, in the industrial countries, people who are refusing these exceptions to the norm. I mean, the curfews and the lockdowns and the limitation on their freedoms, because they think this COVID-19 is whole set up. I mean, it's not true. So how can we convince these people that it is a danger? I mean, while they see that whole economies have collapsed and millions of people are infected by the disease, and also another million and more have lost their lives. And there are a lot of people, thousands and millions in the under artificial respiration because of this pandemic. The pandemic is real. The danger is real. It's serious. It's taking lives. It's destroying economies. The vaccination is the only way to deal with it, to ensure some collective immunity and move forward, hopefully, to a new norm, I mean, or a new normalization of life, to allow millions of people to come out, work, and take care of their families, and to allow countries who are least developed to go on their development programs, and allow the industrialized countries also to recover, and for all humanity to act in a spirit of solidarity. Our hope in the OIC is there will be some kind of vaccines democracy, so to speak. And this is a word that have been said throughout during the last weeks and months, because we have seen that we don't want anyone to be left behind. But this is a very complicated equation again, and it's beyond our capacity, of course, to impose our will on different nations who are providing the vaccines. But from our perspective, we call for more solidarity-based approach towards this vaccination issue, more unity in dealing with this issue, and as I said, more international cooperation, more multilateralism in dealing with the pandemic. Thank you.
While you're speaking, Dr. Rizali, we have another question directly about the OIC, which is quite interesting, from Dewi Tricia Putri at Maastricht University in the Netherlands. She's asking, how does the OIC handle vaccine hesitancy when it comes to the halal status of vaccines that are being used for Muslim communities? Is that an issue, and how does the OIC, what stand does the OIC take on halal status for vaccines?
Well, as I said, I mean, the IOC is the umbrella organization for the Muslim world. We have a lot of specialized agencies. For example, the Islamic Bank of Development has put forward like a $2.2 billion in order to deal with this issue, providing different resources for countries to have the right preparedness to deal with the issue. But beyond our resources, it's beyond our resources to provide vaccines for all the 57 member countries. What we are trying to do basically is we are working with our partners at the international level, being the biggest actors on the international scene, the US, China, Russia, and other countries, and also with the UN and its specialized agencies, with the European Union, to, as I said, to promote this solidarity-based approach dealing with the vaccines issue. So what we are doing is basically continuing our campaign, first of all, to sensitize the citizens within our member countries and throughout the world, I mean, to adopt a reasonable approach when it comes to COVID-19, its consequences, and also to the vaccination issue. So in terms of the financial resources, the Islamic Bank of Development and the Islamic Solidarity Fund are working hard, especially with least developed countries, within this broader framework of COVAX, which basically try to provide vaccines to everyone, not to leave anyone behind. But we have seen, I mean, there is a very, very slow motion, I mean, of this vaccination issue. Some countries have reached like 40% of vaccination of their population, while others are still in 0.5 or 1%. So this is a huge gap in terms of vaccinating citizens. And our approach, as I said, is more based on this international unity, international cooperation, international solidarity. That's my answer to this question.
Thank you so much. Thank you so much. I'm gonna turn back here to Dr. Pajar for a moment and see. Do you have any help for us on how to overcome vaccine hesitancy from the research that you've done and you've been looking at on socio and anthropological factors?
Yes, but before I answer, I like to apologize if the connection is not good. It seems that the internet connection at my place is unstable. So
We can
sorry.
hear you just fine now, I think.
Yeah, yeah. I hope that it's still at least you can hear my voice. Yes, I think one of the things that I like to emphasize that the variety from anthropological and sociological point of view, the variety of responses is something common. So that people always respond to anything in various ways. So there's some, people believe in that vaccine. Some people do not believe. So it's part of our human being. I mean, anthropological sense, we will say that that's human. But then the question is rather to try to understand why or in what context that people feel or people believe or people do not believe. For example, uh, why they don't want to get vaccinated. So this is for anthropologists and sociologists are the most important questions. It's not to understand why people uh, uh, differs in terms of their behavior, but in order to understand what context that people that help shape the people behavior. So then, yeah, of course, you have to do some kind of a field research, try to understand why people do such a thing. And some people tend to use for example, the survey methodology to understand this, the reason behind why people choose to act in certain way. But some other people like anthropologists and sociologists will do more qualitative research to understand what are the factors that are influencing or shaping the behavior. And then the consequences of this kind of thing is that the answers will be also different. The answers that you get from Jogja, for example, will be different from the answer you get from Aceh, or the answer you get from Maluku will be different. The answer you get from Papua. There are some, a combination of factors that are different. So yeah, again, this is somehow from policy kind point of view, maybe it's not really helpful because policy always tends to look for major factors, major influence, something that is uh, influence and affect people everywhere. It can be fake news. It can be anything. It can be many things. But the policy from this kind of policy kind of view, you tend to see to look for a single factor that can influence people behavior. But from my point of view, and I think from many anthropologists, sociologists, then you have to go to the context. You have to go to the social context. So there is no, as I said, there is no one policy fits for all answer to that question. So yeah, unfortunately in Indonesia, this is something that are being overlooked, and then you tend to see as kind of a to see in order to influence behavior, then you tend to take the kind of a more helicopter view and try to understand the problem, which I think somehow important, but it is not really enough. So that's basically my answer, Lynn.
Sorry, I was muted. It certainly is true that in Indonesia, we tend to look, or the country tends to look for the policy that's going to fix everything. Let's see if we can sign a regulation that will fix all the problems, and that is something that does not happen easily. I think we got a time for one or two more questions. Dr. Razuli,
Mr. Lin,
please go ahead.
I just grab some in the gist of the question. Basically, the person who put the question on talks about the halal vaccines and the hesitancy. So, as I said in my presentation, I mean, when it comes to saving lives, Islam allows exceptions to the rule. I mean, is there a halal vaccine ready now for the people in the Muslim world? It's not yet available. How can we wait, I mean, to save lives? So this halal issue, I mean, it's dealt with by some specialized groups of people or the Islamic Fiqh Academy, but the principle says that we need to save lives. So this issue could be postponed to a further stage. Now we have to do with what we have in hand. In order to save the Muslim community's lives, we need to vaccinate them with the vaccines that are in the market now, pending halal vaccine will be produced in the future. So it's not a question of halal or haram. It's more a question of saving lives, of preserving the communities, of dealing with the issue with what we have in hand. And of course, research is going on to provide for this halal or haram vaccines. But the principle is saving lives and making the necessary exceptions, so to speak, in order to deal with a present, with an extremely dangerous pandemic that have taken life, destroyed economies. So this is not basically our focus, I mean, to decide whether it's halal or haram, but our focus today is to protect people, protect communities, and get things to normal back again. Thank you.
Thank you. I think before we close, I'd like to see if Muhammad Idris, who has put a comment in the chat box, which is quite germane to our discussion and to this entire conference, if he might like to say a word. Pak Muhammad, are you there? Pak Idris?
Yes, please.
Please.
Thank you. Thank you for the excellent presentations by the honorable panelists. On behalf of ICCIA, to commend the presentations made just by the brother from OIC and the Mr. Fajr as well. ICCIA has been doing a lot for creating awareness among the private sector for as the economic impact of the during the pandemic, and the joint organization of this conference is one of the witness for these efforts. And as you know, among the most important of these challenges is also the crises occur in the least developed countries in this world, which are unable, and due to their limited resources and preparations to face them. So as a result, these local crises turning into international crises and affecting all of us. So ICCIA is emphasizing on the joint action is the only solution to face these challenges, and it began with the constructive dialogue such as this conference that we are witnessing, and the continuous consultation and analysis for long-term planning by the experts in this field. Thank you very much.
Thank you very much. If either of our panelists would like to have a final word, please go ahead before we close. We're just about at the end of our time.
Yes. One thing I like to add to the discussions. The case of halal and haram. It's for me. It's really illustrate the point that I like to make. Then there is when you have a question, say why do people hesitant to take the vaccine? And if you pose the question to our brothers in Papua, for example, or in North Sulawesi, then the answer will be different from the if you ask the questions to our brothers in Aceh or in East Java. So I think this is the importance of looking at very contextual issues, and then the question of halal and haram will not be very influential in Papua or North Sulawesi, especially among the Christian community. But there are some other considerations that we have to understand. So if we have this kind of a one policy fits all and try to understand the complexity of the cultural complexity and the sociological complexity in Indonesia, then it's very dangerous. And a lot of policy that we are trying to implement in Indonesia, it's coming from the understanding of society that is more or less, I will not say homogeneous, but more or less less diverse than Indonesia. So this is the problem with our policy in terms of not only COVID and other things, but also some in general sense that we tend to pay less attention on this cultural diversity and sociological diversity, and kind of try to see it as a kind of a formula that will applies to from to people living in Aceh to Papua, which I think somehow can be rather than uh, uh, effective, because Indonesia cannot be Indonesia is not Japan, or it's not Taiwan, or it's not like Malaysia. That so yeah, that's my last point. Thank you, Lin.
Thank you.
If you don't mind, Mr. Lin Newman, I want first of all to commend the work done by the ICCIA in a spirit, of course, as I said, of cooperation, collaboration with the OIC and with other different partners. And I want to mention something that would be my concluding remark. I mean, the COVID-19, as they say, comes with its trail and compensation. The trail, it has revealed that our ecosystems, our school system, our way of doing things is vulnerable and fragile to some extent. And the compensation is that we have seen a lot of good things within societies, of course. This span of solidarity among the nations, the solidarity with the poor, the solidarity with those who have become with no income after losing jobs, that's something huge. I mean, that's what we basically, the Muslim Ummah and international community is about. So we have to work on different things. We have to work, first of all, on improving our ecosystem. We have to work on improving our school system as well. I mean, to adopt this distance learning. We have to reduce the gap in digital technology. I mean, these are very positive things that have come out of the COVID-19. This solidarity based approach that the international community is basically promoting today is something new. I mean, we have seen a lot of solidarity among nations, among people. I mean, people in Morocco sympathize with those in Australia and the United States because there are a lot of loss of lives. And this is something new in the international community. We know that national politics is about national security interests, but this crisis and the management of this crisis have showed us that multilateralism can work. Unity can be an actual fact, and solidarity is basically can be enacted if there is goodwill on the part of the members of this international family that we belong to. Thank you.
Thank you very much, Dr. Razui, Dr. Fajar. It has been my great pleasure to be invited to speak at this forum today. I think it's a wonderful opportunity, and I'm honored that my organization, AmCham Indonesia, was invited into this. I thank the organizers for the opportunity. And it occurs to me as I was listening to Dr. Razui just now, we are united in the world in a way that we have rarely been, other than in times of world war. This is an experience that we will share with one another worldwide, wherever we go, from here on out, whoever we meet, anywhere in the world, either virtually or physically, will have a shared experience. And I do believe that this is the hopeful side of this, is that shared experience of hardship and anxiety and worry and eventually triumph over this pandemic will help to unite countries and peoples in ways that we haven't seen in some time. So that to me is the hopeful side of the pandemic. We're not there yet, but I hope that we get there and that we'll be able to put aside some of the partisan differences and some of the cultural and religious differences that sometimes seem to divide us, because there's something very fundamentally human about this experience that should hopefully bring us all together. Thank you for allowing me to be here. It's been a great honor. Thank you for letting me speak my piece. I'm not an expert, but I very much have enjoyed this session. It was delightful to meet both of you. And I'm going to turn things back over to our hosts. I'm not sure who the host is, but whoever that is, you're in charge. I'll give you the floor. Thank you very much. Terima kasih banyak.
Thank you.
Thank you.
Prosedur penggunaan uji cepat. Pengujian dilakukan pada suhu ruang. Pengujian dilakukan mengikuti instruksi penggunaan produk. 1. Teteskan buffer ekstraksi ke dalam tabung sebanyak 15 tetes. 2. Masukkan swab stick ke dalam nostril pasien hingga mencapai permukaan posterior nasofaring. 3. Putar swab stick perlahan sebanyak 5 kali untuk memperoleh lebih banyak spesimen. 4. Tarik swab stick keluar melalui rongga nasal. Masukkan swab stick ke dalam tabung ekstraksi. Kocok swab beberapa kali untuk memastikan spesimen terlarut dalam buffer. 5. Angkat swab dari tabung dan peras swab dengan cara menekan dinding tabung untuk mengeluarkan cairan dari swab. Kemudian, pasangkan tabung dengan penutup. 6. Buka kemasan alat uji, lalu letakkan alat uji pada bidang datar dan bersih. Harap gunakan alat uji segera setelah kemasan dibuka. Lakukan pengujian pada suhu ruang dan jauhkan dari paparan sinar matahari langsung. Teteskan sebanyak 3 tetes spesimen yang terlarut dalam buffer pada alat uji yang ditempatkan di permukaan yang datar dan pada suhu ruang. Amati hasil tes dalam 15 menit. Jangan mengganggu alat uji hingga waktu hasil pembacaan selesai. Hasil tidak valid jika dibaca setelah 15 menit dan mungkin menunjukkan sinyal positif palsu. Itulah prosedur penggunaan uji cepat. Uji cepat, cepat, praktis, dan andal.
Thank you so much, Mr. Newman, for being the nice moderator in our session for the topic of new cultural adaptation. Also, I would like to thank you to all the speakers for making time to join us today, and also we having new insight about several important things in cultural issues, include about halal and haram issue. Okay, so I try to make the conclusion for today activities, today agenda. From Bu Retno, there are three critical aspects for tackling COVID-19. Strengthening international cooperation, like expanding the vaccine distribution to all the countries. Economic recovery, economic collaboration for all countries. Also strengthening multilateral system. Diplomacy takes significant roles on vaccine supply within a country. We learn from Ministry of Foreign Affairs, Ibu Retno, that Indonesia is appointed as co-chair of COVAX. So it's very significant roles in COVID-19 vaccines global access, a global initiative aimed at equitable access to COVID-19 vaccine. From Mr. Cecep, main objectives of vaccine diplomacy are securing safe, effective, and affordable vaccines for national resilience and actively participating in global effort to ensure fair, equitable, and timely access to vaccines for all. Indonesia supports the role and contribution of Coalition for Epidemic Preparedness Innovation as connectors and enable. Indonesia urges the importance of concrete engagement to low middle income countries, especially in the process of the preparation for second wave of COVID-19 vaccines, in which Indonesia could be the production hub of regional vaccine. Indonesia encouraged cooperation between CEPI and government for joint campaigns emphasizing strategic role of multilateralism and CEPI in mitigating the pandemic. From Chief Multi-Sectoral Engagement for Health Security and the IHR, WHO headquartered Geneva, Switzerland, Mr. Ludi Suryantoro, the health sector cannot handle a pandemic alone. The world needs a political commitment to ensure an interconnected multi-sectoral preparedness for health security. Multi-sectoral engagement for health security will support countries to prevent, predict, respond to, and recover from the current and future health emergencies. From Kunihiko Hirabayashi, in January 2021, schools closed again in Malaysia, Mongolia, Myanmar, and Thailand. UNESCO estimates that at least 2.7 million children across the region will not return to school once they reopen. There is a rocky pathway to COVID-19 deployment and vaccination. Many low and middle income countries lack the capacity to accurately estimate and map appropriate target population, such as older age group with comorbidities or specific health condition, such as disabilities. Vaccine distribution and storage need to establish, strengthen a chain of reporting and management structure, particularly among provincial, district, and local levels. Vaccination, monitoring, and response need strengthening of capacities of frontline health workers and systems. Clear communication to address unmet high demand or increasing vaccine hesitancy trend against routine. IKA UNPAD, Kadin, ICCIA, and business and community leaders can help to advocate fair distribution of vaccines, can help to build trust in the vaccines and encourage being vaccinated, can help to scale up family-friendly policies and other good workplace practices in the context of COVID-19, can help to ensure all children learn, including by closing the digital divide, and can adapt coping and protection mechanism to address mental health, especially for young people. Mr. Sony Hari, Indonesia is a vast country with variety of local culture and language. There are people who comply to health protocols. In other hand, some people are semi-compliant and disobedient. There needed to encourage behavior change in communities that are semi-compliant or disobedient with health protocols. Many moves have been made to change the behavior start from public to several behavior change programs. First, behavior change guidelines have been made in 100 local language. Campaigns from behavior change, duta perubahan perilaku that become a role model and educate public about COVID-19, village or sub-district command posts that become the center for planning, coordination, and control of COVID-19. And for Mr. Fajar from CSIS, the COVID pandemic teaches us that Indonesian society is not a communal society like what most anthropologists believe. Communal standards only apply in restricted contents, family, etc. So, one policy fit for all is not enough because of diversity of local or cultural social authority. Structural factors like regulation play less significant role to shape risky behavior. We need to raise awareness that the collapse of society will affect an individual well-being as well. And the last, Laoshin, 3 critical aspects for tackling COVID-19. Strengthening international cooperation like expanding the vaccine distribution to all the countries, economic recovery, economic collaboration for all countries, strengthening multilateral system. So, diplomacy takes significant roles of vaccine supply within a country. So also we learned from Minister of Foreign of Retno Marsudi that we are now as co-chair of COVAX, we play a significant role in COVID-19 vaccine global access. Okay, there are conclusion today, but moving right along, we have Mrs. Ira, our VVIP in this special event. So would you comment something that you think is important for us, for take home message for us? Some important things, please, Mrs. Ira.
Thank you, Tehlia. So thank you for the speakers, moderators, and honorable guests and participants for a very constructive and very interesting, comprehensive yet in-depth discussions on the topics beyond health itself, which are diplomacy and socio-cultural. And we glad to hear that Indonesia very active in a global initiative and international initiative on the pandemic handling, because we heard from Ibu Retno that she is now co-chair of the COVAX. So it's a very honorable position for Indonesia and very strategic. And also we know that Indonesia also very active in CEPI. We are congrats to Pak Cecep for that role. And also on the socio-cultural, we learn from Hirabayashi-san that something we have to really think about is how we can give rights to our children, because now we have competing needs among the senior citizens and the children. So maybe we hope we can sort out how to distribute vaccines in a fair manner. And also it was a very important and interesting discussions about halal and haram on vaccine. And I hope that OIC countries, as the biggest representative of Islamic countries, can have a discussion and give us solutions on how we treat this halal and haram issues, because Indonesia has more than 90% Muslim. So I hope that we can learn from this conference how we treat these halal and haram issues. But we heard from Brother Tusap from YC that the most important thing is now how to treat the pandemic, and maybe we can more conservative on this halal and haram issues. But of course, we hope we can sort this out. And I'm very interesting to learn tomorrow's session is about the global economic solutions. So we will learn from global economic leaders. So maybe for the participants, honorable guests, let's meet again tomorrow in the most interesting topic on economic recovery. Thank you.
Okay, thank you, Teh Ira. So maybe in your perspective, Kang Kus, you have like another.
Yes, Teh Lia, thank you. I have very important notes. Foreign ministers and the speaker in the session all remind us again that no country can deal with the pandemic alone. Cooperation and multilateralism are needed, including in vaccine development and vaccine distribution, because, as the foreign minister stated, no one safe until everyone safe. Ladies and gentlemen, this distinguished speaker and moderator, thank you for your participation today, and we still have the last day conference tomorrow. We have honorable keynote speaker, His Excellency Mr. Erick Thohir, Minister of State-Owned Enterprises of Republic of Indonesia, with the topic Public and Private Sector Role in Economic Recovery. And still we have two sessions tomorrow, Global Economic Recovery session and East Asia role in the Global Economic Recovery session. We will hear, and we have a prominent speaker tomorrow, His Excellency Ms. Mari Pangestu, Managing Director of World Bank. And we will hear closing speech from Honorable His Excellency Kiai Haji Ma'ruf Amin, Vice President of Republic Indonesia. Again, I want to thanks to our generous sponsor. First, the main sponsor to Bank BRI and Uji Cepat, and other sponsor MNC, BNI, Kadiga Capital, Paragon, Godrej, Telkomsel, and also to media partner and media coverage, Bloomberg, Media Group, Metro TV, Media Indonesia, Medcom ID, TV One, Berita 1, MNC, Sonora, Economics, Pikiran Rakyat, RMOL ID, Republik Merdeka, Farah, Unpaders, Mara FM, Raka FM, RIS.id, Jack TV. Thank you for all your participation and support to this event. See you tomorrow. Stay safe and healthy. See you tomorrow. Thank you.